Great. Thank you, everyone. Can folks hear me? Gail, I'm going to use you as the test. Can you hear me? Perfect. Awesome. Great. Well, thank you, everyone, so much for being here for this special convening of the California Interagency Council on Homelessness. As you'll see, we are doing things a little bit differently today. So ask and you shall receive. You can probably tell we are in smaller breakout tables here, so we'll explain what that's going to look like for the meeting in a bit. But for now, before we get started, this meeting is being recorded. There are mics on each of your tables, so there's handheld mics that you can turn on and off using a button, and there's a red light that is on when it's off, and there's a green light that comes on when the mic is on. They do take a second to get started, so give it a second, and if it's not working, you can just wave it and we'll come get it from you. The bathrooms and water fountains are outside these doors to the left if you need anything. Also, we know that this is a slightly longer meeting and it is lunchtime, so feel free if you have food or if you need to stand up, do what you got to do while you're here. We completely understand and encourage everyone to take care of themselves. Also, it is very hot. Hopefully not in this room, but if you need anything during the meeting, please flag us down. I said this, but the meeting's going to be different from others. We're going to focus on giving folks as much time in small group discussions as we can. I can tell that that's already working from the conversations that have been happening before the meeting started. But please forgive any technical or logistical challenges we might have in the moving around of the room. And the meeting will get started now. So I'll bring up Megan to get us going.
All right, good afternoon, council members and members of the public. Thank you for joining us. As Cody said, it is very hot in Sacramento. My deepest and sincerest condolences for you joining us from the Bay Area or from Southern California even. I'm Megan Marshall. I'm the Executive Officer for the California Interagency Council on Homelessness, and I have the pleasure of opening our meeting today. Thank you for your commitment in joining us and for your commitment to our joint vision of preventing and ending homelessness in Sacramento. It's something that we've said for a very long time, but it is something that we have very recently, in our June council meeting, recommitted ourselves to. And I hope it's something that this body is excited for. So a few reminders before we begin. This is, as Cody said, a 4-hour meeting. I will say, Karen, if you can just give everybody a wave in the back there. That's Karen Perry, our wonderful executive assistant. She is safeguarding a red igloo that has dry ice and some popsicles for our council members. I'm sure there will be some leftover for members of the public. There's watermelon, pineapple, lemon, and strawberry with a side of tahini for those of you who are interested. So please help yourselves. It's a hot one. All right, so prior to this meeting, council members were provided with a briefing packet, which also is available to the public on our website. We will try to leave some time for council members to ask general questions towards the end of the meeting, but if we run out of time, which we likely will, please feel free to reach out to CalICH staff with any questions after the meeting. There will be some contact information for members of the public at the end of today's meeting. We're very excited because we have a new clicker. Let's see if I can use it. Oh, what do you know? Perfect. Just a brief overview of today's agenda. We'll do a call to order, tribal land acknowledgement, and a roll call. We'll kick it over to our awesome co-chairs for council opening remarks. We have a very exciting visioning exercise, which we'll explain a little bit later. Our action plan core elements overview, developing bold actions, and action plan innovations will take up the bulk of today's meeting. We'll end with general public comments and final remarks and adjournment. I will say, because today is so long, we do have a 10-minute break in between. But for those of you who are joining us in person, please feel free to get up and move about the room and give yourself a stretch. So with that, the California Interagency Council on Homelessness is hereby called to order on this day, July 11th, 2024 at 12:08 p.m., which I think is a record start for us. So with that, I will turn it over to our fantastic tribal liaison, Vivila Blossom and Bear, to read the tribal land acknowledgement. V, you're on mute.
Thank you. Thank you. Good afternoon and thank you. We wish to acknowledge that Sacramento is the unceded homeland of the Southern Maidu, Valley and Plains Miwok, the Nisinan people, the Patwin Wintun people, and members of the Wilton Rancheria tribe who have inhabited this landscape since time immemorial. We extend our gratitude to the ancestors of all California Native American tribes and their descendants, as we recognize that wherever we are joining from in our virtual community, we are all on California Native American land. Thank you.
Thank you, Avila. And we look forward to hearing from you in future council meetings. Avila is now officially the tribal liaison for the California Interagency Council on Homelessness. I think folks remember me saying in the last meeting that she, in her position prior, had been tied to grants, which happily and officially have been transitioned to our sister Department of Housing and Community Development. But Avila will remain in her position and continue her important work. Thank you, Avila. Claire Bannerman, would you like to call the roll today?
There we are. Hello, everyone. I just wanted to make a note for any of members of the public who are here in person. If you would like to make a comment at any of the available times, please see Karen in the back, and there'll be comment cards, and fill out one comment card per agenda item, and you will have 2 minutes like usual. Okay, so this is the attendance roll call for the council. We need a majority of members or a quorum to officially meet and hold this meeting. Council members, after I call your name, please say present or here. Apologies if I mispronounce any names. Designees, please state your name and which council member you are here for when I call the council member's name, and state that you are representing them. Okay, Tamika Moss.
Present.
Dr. Mark Galley. Present. Dr. Tomas Aragon. Michelle Boss. Stephanie Clendenin. Susan Damaris. Kim Johnson. Tina Johnson Hall. Thank you, Gail. Margot Cushell.
Mark Dones for Dr. Cushell.
Thank you, Mark. Veronica Lewis. Oh, okay. Jeffrey McCumber. Thank you. William McGee. Kaina Pereira. Thank you. Rebecca Rawan O'Shaughnessy. Lindsay Sin. Tony Tavares. Gustavo Velasquez. Nancy Ward. Marina Wyant. And Joe Xavier. Thank you very much. We have a quorum, and Cody will take over for the next agenda item.
Great, and we're going to do the mic pass. I believe we are on to our council co-chair opening remarks, so I will pass it to Secretary Moss.
Secretary Galley, I wonder, since you are in person, if you want to begin. I wish I were there with you all. I'm happy to have home rule here and then offer remarks when you're finished.
Is this, oh, perfect. Look at that. So turning my, sorry, you will see my back, Tamika, for a moment. So first, I just want to thank the council members for adding in on a very, your busy schedules to agree to another meeting. We, as a team, I know Megan and team felt how important it was for us to come together and have a meeting like the one we're about to have. And as a co-chair, and I think I speak for Secretary Moss as well, that if the state is as serious as we say we are at ending homelessness and leaving no stone unturned in that pursuit, then the action plan should be the manifestation of all the work that gets that job done. And so to put this kind of effort and time and attention with the leaders around these smaller tables in this unique format, we think will get us there in a way that we haven't been able to get to in the past. So as you roll up your sleeves today, you think about what you've been doing already and close your eyes and imagine a California where our underpasses and our open spaces and our parking lots aren't places where people are living, and that they're in homes and houses across our state. I know your energy and focus on getting to that has been longstanding, and today is an opportunity to help manifest this action plan as something we can all lift up and hold ourselves accountable to in the months and years to come. I know that means thinking about our data systems, thinking about how we measure, how we hold people accountable, but at the very basic end, it starts with that goal at front and center of the people that we're here to serve. So I'm excited about hearing the ideas from our tables as we bring them together, and at the end to see how we advance this essential work that we're all doing. So with that, Tamika, I'll turn it to you.
Thank you so much. I couldn't have said it better myself. I'll just add that, you know, what's exciting to me about today's meeting and conversation is building on the energy that I felt when I first, at my very first ICH meeting as co-chair back in April, when I got the sense that every single council member who was present in the room really wanted to roll up their sleeves and participate in the co-creation of an action plan that actually focused not just on sort of what we're doing today, but outcomes and goals that will actually help us prevent and end homelessness in the state of California, providing direction and technical assistance for our local partners to do the same on the ground. And so, although it is a tremendous time commitment for us to all be together, this opportunity for us to dig into the content, the staff have done a really incredible job outlining the feedback that you all have provided to them directly. And, you know, as Dr. Galley said, I think all of our brains need to be sort of dedicated to this action plan so that we can not only put into practice what we think is necessary in terms of strategies and outcomes, but have an all government approach where we as council members will hold ourselves accountable to reaching some of those goals that we come up with today. So I am really excited to participate. I'm sorry I can't be with you all in person, but it was really important for me to participate virtually. The last thing I'd say is, you know, I have talked to many of you all, and you, having done this work for a really long time as well, recognize that homelessness and housing insecurity is not happening the same to everybody in our community. Our Black, Brown, and Indigenous neighbors are experiencing homelessness and housing insecurity disproportionate to their counterparts. And so I really am excited to think about how do we bring our commitment to equity as a state, and as you all do in your day jobs, not just on this council, how do we bring that to bear to not just lift up what those disparities are, but actually figure out ways to reduce those disparities as we implement the action plan. So thank you so much. I'm really excited to be with you all today.
Great, thank you both. And yeah, just want to echo the thanks. We know it's very challenging to get on folks' calendars, and for you all to be here and giving us your time is really meaningful. So I'm just gonna, before we like fully jump into the meeting, I just want to frame why we're here. As Dr. Galley and Secretary Moss have both said already. So this meeting came out of a previous council meeting where we talked about the action plan. We had some breakout discussions. We heard a lot of really, really positive feedback about the ability to discuss in smaller groups, to really generate ideas and feel ownership over the plan. So the goal today is to continue to feel that ownership, right, over the action plan, and also really come out of this meeting with sort of ideas and understanding about activities that can be included in the plan that really represent the collaboration or the complementary work that we all have going on, so that we can include those in our plan and make it, live up to the bold call that we've been hearing from this council. So the way this is designed is sort of 4 main points. The first point is we're going to hear from the LEAB, and they're going to help us think about our vision, right? They're going to say, we've asked them a few questions to respond to. They're going to help us say, what does it look like to be successful at preventing and ending homelessness, right? So they are a very good source of information and knowledge for that work. So they're going to help us with the visioning part. Then we're going to discuss the core elements of the plan, because we heard loud and clear people want to talk through the vision, the guiding principles, and the goals. So we have more information on that. And then really the bulk of the plan is going to be discussing in small groups, sort of areas of overlapping work, what activities you all are thinking about including in the new plan, how you can collaborate. I've already heard little conversations happening about, oh, I've been meaning to talk to you about this, or I've been wanting to connect with you for a while. So that's what we're doing here today. And then we will end identifying sort of like what other work is needed in order to ensure that our plan is as successful as possible, right? If we're really trying to live up to this vision and these goals that we're setting, what else, a plan is great, but it's not going to do it alone. What else do we need? So that's the idea for today. Just wanted to sort of frame that before we jump into a conversation with the LEAB. So I will pass it to Megan now.
Turns out I'm not great with the clicker, but thank you, Cody. So to ground us all, there we go. So to ground us all in our purpose here today, our Division of Local Initiatives has partnered with 4 members of our Lived Experience Advisory Board and developed a visioning exercise, really to set us and make sure our roots are deep and very well connected, reminding us all why we're here today and who it is that we're intended to serve. So we'll first hear from members of our LEAB and then ask a question of our council members. So with that, I will now turn it over to our Cal ICH LEAB liaison, Lisa Avron. Which I'm happy to man the clicker for you back here, if that's helpful. Yeah, great.
Hi, good morning, everyone. Good afternoon. My name is Lisa Avron, and I am the liaison for the Lived Experience Advisory Board here at Cal ICH. It's really good to be with you all again. Today, we are joined by, I hope, 4 LEAB representatives. Looks like, there we go. We have at least 2, I know, with us. Hopefully the other 2 will be able to hop on. They will each speak from their expertise on the most critical interventions or resources, those that made the most impact in preventing or ending an individual's experience of homelessness. They will also speak to, in their experience, interventions that did not work, why they did not work, and what changes could be made to make them more effective. Each speaker will share for approximately 4 to 5 minutes, and then we will have time remaining for the council to reflect and speak as well. And so with that, I will introduce our first speaker, Melanie.
Hi, Council. Thank you so much for having me here. Lisa, thank you so much. My name is Melanie Robledo, and I am gladly serving on the LEAB. Currently, professionally, I am the Senior Program Manager for the National Reentry Housing Incubator at Impact Justice.
Thank you, Melanie. And this can be your moment to also speak on your talking points.
Perfect. Thank you so much. So the first talking point that was given to me is imagine a future where homelessness is rare, brief, and a one-time experience. In my experience and expertise, what is the most critical intervention on a resource that can make or has made the most impact in preventing or ending an individual's experience of homelessness? For me, the most critical intervention was feeling a sense of belonging and a person-centered approach. I needed people, programs to meet me where I was and encourage me to be the driving force of my ship to success. In a future where homelessness is rare, brief, and a one-time experience, we need to stop thinking one size fits all and create space for more bold ideas and innovation. So the next one is, why is this intervention or important in preventing homelessness? A person-centered approach is so important because it helps build trust. It is evidence-based and it promotes self-advocacy. To prevent or end an individual's experience of homelessness, the solution has to be a hand up and not a handout. This can create a level of appreciation and gratitude that is invaluable when addressing a barrier or obstacle to improving the quality of life. The emphasis here is on quality of life because it is too often that I've seen solutions that do not maintain the dignity of humanity. With a person-centered approach, an individual can exercise what they think would be best for them and align their goals with their values. What are some specific on-the-ground examples that will help the council understand this? Well, at times it can be beneficial for me to articulate my experience in order to paint a vivid picture of my past. I do not seek pity, but rather aim to inspire hope that transformation is possible. Just under 4 years ago, I found myself teetering on the will to live while experiencing homelessness. Driven by desperation, I made reckless decisions, even attempting to take my own life multiple times due to overwhelming shame. I lost custody of my children. I burned bridges with loved ones, battled addiction, endured physical and sexual abuse, and grappled with severe mental health issues that clouded my daily function. Today, I proudly hold the position of Senior Program Manager at a prominent national nonprofit organization dedicated to addressing the prison to homelessness pipeline. What brought about this remarkable change? It was a program inside the county jail that by pure grace matched me to shortly after being released from the mental health unit to general population. While the circumstances surrounding my transition between modules and subsequent engagement with the program were a separate discussion on potential improvements, I'm grateful for the opportunity that came my way. This program equipped me with the necessary resources and tools to secure housing and employment post-incarceration. Although I had participated in drug diversion programs in the past, this program in Los Angeles stood out for its tailored approach to meeting individual needs and aspirations. I never felt constrained by a one-size-fits-all mentality. Instead, I was empowered to recognize my own capabilities and channel my determination and passion towards mission-driven work. This experience instilled in me the confidence to effect meaningful change for others, fostering a society built on mutual support, justice, and opportunity. Thank you for allowing me to share.
Thank you so much, Melanie. We love hearing it. I love listening to you speak, and I really appreciate you sharing all that vulnerability and personal experience with us today. And hopefully we can use it to empower our decisions. All right, next, I believe we have Mary. Is Mary still in the Zoom room? Yeah. She is. Yeah. Mary, if you can hear me, can you please unmute? I know you're going on a little bit earlier than expected because our other two members aren't present yet. Got you. What happened?
We're sending her a chat.
Okay. We're sending Mary a chat. I'm going to see if she can join us. Sure, yeah. All right. Hearing nothing, I will pass it back to Megan.
Thank you, Lisa. Thank you, Melanie. Very much appreciated. Hopefully we can hear from Mary in the next few minutes, if not one of the other two lead members. But recognizing this meeting takes place on a work day in the middle of the day, this is a little bit of a challenging time for folks to make. But thank you, Melanie, for making the time. We always appreciate hearing from you. So with that, we'll move forward to council reflection questions. So posing to you all, what ideas or recommendations did you hear from the lead member who spoke that connect directly with the work you oversee or that your department or agency is responsible for?
Again, we have someone on the screen.
Director Johnson, if you just give us a second, it looks like we have a lead member. It looks like this might be Mary. Mary, if you'd like to unmute yourself and share, and I'll go back in the slides. Mary, can you hear us? You want to take yourself off mute and share the responses to your questions? I'll give it just a second, Mary. Mary, do you see a prompt on your phone or on your screen that says unmute? No? Okay. Mary, just give us a second. We're gonna push forward a little bit, but then I'm gonna come back to you. Folks are gonna reach out separately to offer some technical assistance. So you should hope to hear from Lisa. Thank you, Mary. All right, so back to our council reflection question of what ideas or recommendations did you hear from the one lead member who spoke that connect directly with the work you oversee or that your department or agency is responsible for? And I saw Director Johnson go for the microphone. Director Johnson.
Yeah, thank you. And again, really appreciate Melanie taking the time to share her story and experience. And I think what resonated was her comment about meeting the individual needs of the person, being person-centered, that one-size-fits-all approach doesn't work for everyone. So that is certainly something that we have been thinking about, creating flexibilities and providing those flexibilities in our program design as a result. So I think that was affirming for us at Social Services of really being able to listen to the goals of the person and help meet their individual needs as they're looking to support their housing needs.
I hear some audio. I think it's coming from Mary. Mary, can you say something for me?
Yeah.
There you go. All right, girl. Let's hear from you. I'm going to go back one slide.
Okay. They can hear you.
That's okay. We know you got a lot going on over there, but if you can share your responses to the question, we'd appreciate hearing from you and your expertise.
Okay. Were you gonna ask something, or did I just read off of my?
Yeah, just read it off what you and Lisa worked on collectively.
All right. Well, I believe the first question was about critical intervention and resources to what has helped me get out of the situation and that I'm in, or to help either my friends or acquaintances. But I had trouble answering the question because I haven't myself came to anything that's been able to help us or me in this situation. It was about a year ago that I started living on the streets, and I still am. So I'm still looking for the resource that's able to help us. It's not been easy, but I mean, I don't really know, but I just nothing so far has helped us. There's been resources like, let's say, KCAO, which is a King's Community Action here in our local city, that a program that helps out with homelessness and helps you do vouchers and whatnot like that. But you add those also themselves, because you have to understand, if you're homeless, a homeless person's not going to be walking around with their birth certificate, their medical record, their forms and everything that they need to fill out that application. So if you don't bring something to that application that they need, you're not even put into the line of you're not even applied at that moment. You're still still finishing your application moment, and that's kind of hard, because we don't have first off, we don't got the money to get the information that you guys will need, which will say it's a simple ID. Well, they made that easier because we can get them free now if you're homeless. But for other people that just have a hard time getting their birth certificate, that takes money and that takes time to go get done. But so we're not all walking around with it. So it gets kind of hard. A lot of resources don't want to help you if you don't have kids. Also, that's like a big thing. Most of the people that are homeless are not going to have children with them. Most of the time because either they got them taken away for social services and or because they just don't got any. They're just older folks and just I guess live homeless. But there's a resource that we got a couple of voucher resources here in town. We have no local, like if you're homeless, there's nowhere you can go here. There's no shelter. There's no place like that here in our town. There's little places that you can go take a shower at. You know, we don't, I just, a lot of resources, I just don't think that we have them here in our town, like a lot of bigger cities like San Francisco or San Diego. And
Yeah. Thanks for sharing that, Mary. Can you, in your mind, you sent me some reflections on if you could change things, if you could add interventions or resources, what do you think those would be?
I actually made a little list. I have like more to say about each thing in the list, but I just made like a little list that I was like, you know, a little key points that like maybe where it can start helping and getting better, or you know, I don't know the answer, but what I wrote was like increasing funding for supportive housing programs, expanding rental assistance programs, promoting housing first approaches, support affordable housing development, enhancing coordination of services, and invest in data collections and analysis, provide trauma-informed care, expanding outreach and engaging efforts, addressing the systematic barriers, and educating the community about it all.
Awesome. Thank you so much. And I remember we were also talking about ways and like programs that you had tried for, but they you couldn't get into, or interventions that did not work for you. And I wanted to see if you felt comfortable with sharing some of that with us today. It's okay if not. I just wanted to ask if you would like to. Yeah.
So first off, like the first thing that I really thought I had really kind of going for me is because the fact that I was a foster kid all my life. I don't know any family, don't have family. I've never met them, nothing. So I thought they gave those incentives, the programs of when you're a foster kid, that, you know, you could get help, housing afterwards. You can get help in school, college. And that actually wasn't the case for me. I haven't gotten no help for being a foster kid. So I've been trying to do it on my own, just, you know, without that little bit of help. And it's hard because I don't have a lot of resource, a lot of stuff that you're supposed to have due to like either moving so many times or whatnot. You know, I just, it's there's barriers in my way that it prevents me from, or like, I guess kind of getting the stuff. But if I had, I don't know, if more resources to help me along with it, I would probably be able to get it done more faster, or you know, wouldn't be able to have to be living on the streets and whatnot.
Like if interventions were more tailored to you and what you needed.
Yeah.
Because
I mean, obviously I can't speak for everybody that wants to be out here on the streets, but you know, majority, I know I don't want to be here.
Thank you so much for sharing, Mary. Are there any closing thoughts you'd like the council to consider?
That's it for now, I guess.
Okay, thank you so much. We really appreciate hearing from you. I love hearing from you. And you can just chill and unmute yourself if you like, and listen to Audrey, who's going to speak next. Audrey Pearson joining us live.
Hello, everyone, and thank you for your time today. Today, the most pressing things that I'm seeing, what's critical, what is working, and what we may benefit from is needed is problem solving and eviction prevention funds, and a department, especially in Compton, Watts, Linwood, and Paramount districts, where there are no supportive services, there are no shelters for our clients to access, and no other resources to assist them. What is also working is Pathway Home project that we had here in Compton, Paramount, and Linwood, Gardena, and in the unincorporated LA County this past fall and this year. Having Pathway Home here in Compton area has truly helped us out tremendously. And the things that we could do in the near future to assist is provide more funding within more focused programs of eviction prevention programs, especially in the Compton, Watts, Linwood, Paramount area as a resident of Paramount, and I am coming out of homelessness of 7 years. There are no resources for me to access, so this would be very important. And also just paying the frontline workers who are working within prevention services, because it's such a great and heavy responsibilities, paying them a salary of at least 26 to 28 hours, $28 an hour, having a strict pilot program to result in the tracking of everything, and then creating more permanent supportive housing for ages 26 to 54 years old. I'm 52. I can't get resources. I have a lot of folks on my caseload who are in their 30s and 40s. Everything that's being built is for senior citizens right now, and veterans, but we want those programs to still continue. So, and also second chance housing opportunities for people who have evictions on their credit. Evictions stay on there for 7 years and landlords won't rent to you. And I think that these things will help, as well as providing eviction prevention services for homeless outreach workers, as well as first responders. We're taking care of the city, we're taking care of our unhoused community. It would be nice that we don't also have barriers to prevent us from getting assistance. I can't get assistance at my job, even though we're the lead agency in my area and I live in Paramount. So I'm not included. So I fall through the gap and I'm still facing eviction. So these are the things that I'm asking for, and I really appreciate you guys for your ear.
Thank you so much, Audrey. Love hearing from you. I'm so glad you can make it with us today. And thanks for all your preparation for the meeting too. With that, I'll go ahead and pass it once again back to Megan. If y'all want to hang out on mute and listen to what the council has to say, or feel free to leave if you have to get back to work or do your thing. I will pass it back to Megan.
Thank you again, Lisa, and thank you, members of the LEAD, for joining us today. You're more than welcome to stay. We just ask that you put your microphones on mute, but your expertise is incredibly invaluable and always serves a tremendous reminder as to why we're here, especially on a 112-degree day in Sacramento, California. So thank you so much. Secretary Moss, I see your hand.
Thank you, Megan. And thank you, Melanie, Mary, oh my gosh, Audrey. I'm so grateful for you taking the time to share with the council your experiences, but also as we get ready to go into some detail around the action plan, I'm really interested in how we can think more holistically around, housing certainly is the first intervention to addressing our homelessness crisis, but hearing from you all about the quality of life aspects, like how do we actually make sure that we are thinking about what does it take not to just bring someone inside, but then for folks to be able to stay inside, to thrive, to transition from just looking for housing, but being able to have access to employment and other social opportunities that folks have and desire and deserve. And so I'm really resonating on this more, not just a person-centered approach, but how do we think more holistically around our strategies that are central to housing, but that also take into effect the other aspects of people's lives that help them live their full value and potential. So that's really resonating for me. And I just wanted to say thank you for lifting some of those things up.
Thank you, Secretary. Much appreciated. We hope to incorporate similar exercises in the future. I think it really serves a tremendous purpose as we start these very long meetings on very hot days to remind ourselves that the people that are serving us are also in very hot places and in very long days. So thank you, Secretary Moss. I do see Councilmember Lewis's hand up.
Thank you. And thank you to Audrey, Mary, and Melanie. I think I heard several things, and obviously I don't run a State Department, but I still have something to say. part of the challenge is that folks that are falling through the cracks or can't access it, we don't have formal data about that. And I think that anecdotally, we understand there are a lot of reasons why people that need support can't access it. And I think that spending some time trying to figure out how do we take the information, we've heard it for years and years and years, how do we take that information and reshape the policies, reshape the program design, relook at eligibility criteria, understanding that some of the dollars coming to your departments and agencies are from federal government, you don't control those things, but we have a lot of information, and I think that I'm hoping that we can really figure out how to shift to address those gaps. And naturally, in a scarcity model where there's not enough resources, I know that's a challenge, but I think we've heard enough over the years to be able to do that. The other thing I just want to add to a couple of things I heard from Director Johnson and Secretary Moss around, not only meeting people's individual needs, but their aspirations stuck out to me. And so part of the challenge is pathologizing people. And in particular, as it relates to pathologizing people without regard for the cultural context, socioeconomic context that they're coming from. And I think that our program, not only does it happen on the ground, as it relates to all kinds of things and implicit bias, and I've been doing this for years, so I know what works, but also at the policy level, at the program design level, at the resource allocation level, we are not necessarily creating things to make sure that we have a collective impact model that leaves people thriving. Certainly, we gotta stop the bleeding, figuratively, sometimes literally on the street, but figuratively, and there's an emergency triage situation, there's a stabilization process related to both health and housing, there's a journey movement process right into permanency, hopefully, and stabilization in that regard, because sometimes layers unfold when people feel like they're out of the housing crisis. But there's not a lot of support to sustain that beyond. There's a lot of trauma, there's a lot of other dynamics. And so I think that our programs are not designed to make sure that people are stabilized and are thriving in all the aspects of their lives. And part of that does begin at the beginning, right? Again, and this is where the pathologizing comes in and some of the other things that I said. So I'm hopeful that we can not only look at gaps in terms of filling those and figuring out how we can be thoughtful around these things we've heard for years, but also really hear what people are saying and figure out the things that are within the state's control, that we're not just doing business as usual because we've always done it this way. And the other thing I'll say, the last thing I'll say is that I understand the need to standardize, right? Because we have to have a way to measure key performance indicators. We have to have a way to measure these things. But we've heard so many stories about different pathways that have led to homelessness and the different needs to either quickly resolve it, right? Or the longer term supports that people need. And I think that even though we kind of say it all the time about a menu of options, that's not realized in this state. And so we need to think about how do we embed more flexibility while still obviously having accountability and clarity around what we're measuring. But there's a need in particular with the number of people falling into homelessness for the first time across this state. How do we expand? And I understand the fraud prevention aspect of all the work the state does, which seems to be the driving force of most of the policies, but we really need to, with respect to preventing fraud, right? And making sure taxpayer dollars are spent the way they're supposed to, and all these other things that are critically important, bring it back to what's actually gonna meet the need and how do we determine what that looks like.
Although not from a State Department, always love to hear from you, Councilmember Lewis, much appreciated. I will say, I think we have some agenda items today that will really require the council to have those very conversations. What we're doing clearly is not enough. What we're doing is great, but it's not enough. And so what can we do? What should we do? We'll have a conversation in a few slides on what we're required to do, what Cal ICH as a body is actually statutory obligated to do. And I think that will help drive some of those perhaps uncomfortable conversations forward. So thank you, Councilmember Lewis. And I do see a hand online. Mark, you're joining on behalf of Councilmember Kuchel.
Yeah, Mark Dones, they them pronouns. I just want to lift up, and I'll speak more to this in a little bit actually, but there was a very specific ask I heard from a policy perspective for integrated eligibility and enrollment, like very straightforward. And I would love to use today to spend a little bit. I mean, it'll be in the feedback that we have actually on the action plan. But I think that that is a clear need in this space, and I just heard it really clearly, and I just want to lift that up. Thanks.
Thank you, and thank you for joining us. I see a hand. I'm so sorry. Secretary Sin, if you can help me see that, your neighbor's card there. Yep, Sandy Nieves. Yes, please. Thank you, Sandy.
Hi, thank you. This is kind of a strange position to be in since my director is not here and I have never been to one of these meetings, but I also heard very clearly what was said about not being made eligible for services, right? And I think that we need to really explore other ways that people can be verified. And I hate using that word because a person shouldn't have to be verified, right? So looking at DSS sitting here, I know that there's ways, and DHCS uses other ways to verify people. Like we have a med system that's all the way across, can say this person is who they are without somebody having to have ID. And I think that's a huge, huge barrier for people to be able to get into the services they need. So if they can't even access the services, they're not going to get the help they need. So that's a huge thing I think we need to figure out. Another thing I'm wondering about is that we say we want to solve homelessness, but I'm going to challenge the council with the idea of like, who is the largest segment of homeless population? Who are they? Can anybody respond to that? Single men, right? Ages 45 to 55. And it was shared that single people do not get access to the services that they need. So we, in regard to policy, have the opportunity to change that it's always families that we're focusing on. Families are important, kids matter, but for years we have watched single people and especially men be left on the street and left out of these services. So I'm gonna advocate, and we do have data, we have studies from Sac State, from SFSU, right, that says this is the population that's not getting served. So I'm really gonna push on that one because I've been saying it for years. So I know this isn't like a workforce development thing, but it is a passion of mine and I have been involved in homeless stuff for a long time. So I really appreciate that being shared and I hope we heard that. So Mary, thank you for bringing that up. And I think that's it.
Well, that being it, Sandy, that was quite profound and very much appreciated. I think this body, unfortunately works in silos, just given the nature of the populations that each of the departments and agencies are intended to serve. And the work of this council is to break down those silos, to make sure that we are, as a collective, understanding the population as a whole that is demanding our support and demanding our investment and resolution. So thank you for sharing, Sandy. Any other comments from the council before we move forward? We're a little bit ahead of agenda, which is not a bad thing, but just want to give ample time and space for folks to comment. Secretary Moss, I hate to put you on the spot, but I know workforce development and the infusion and like specific interest in the area of workforce development has been a topic of conversation recently. So hearing what we've heard from a representative on the council today, just curious if you had any other thoughts. I know we heard some tremendous things from our colleagues from Caltrans and CDCR on a employment pilot, I believe it was, for folks who were at reentry population, but moving into the employment field. So, but feel free to tell me, no, thank you, Megan, please move on.
No, I mean, I appreciate the point, Megan, and I think that there's a lot of opportunity for us to look at what, how workforce interacts with folks exiting homelessness. We have been in some conversations with Secretary Knox, who is the Secretary of Labor and Workforce, around how do we use social enterprises, which Caltrans is doing a really fantastic pilot on beautifying California that has assisted more than 6,000 folks who are exiting the incarceral system, as well as those exiting homelessness and housing insecurity into jobs right now. And so I think there's a lot of opportunity for us to integrate that component into our solution set. But I want to lift up what Councilmember Lewis said, which is this includes our belief that we are moving through the stages of, you know, the emergency triage, stabilization to thriving, and responding to that aspiration of employment such that you know, it allows folks to be employed, but family sustaining wages is what allows people to afford their rent and their other household needs. So I think one of our lead members also talked about the frontline workers who are doing this work every single day across our nonprofit sector and otherwise earning wages that allow them to not be vulnerable economically themselves. And so I think there's a whole gamut of things in that space that potentially the action plan and council members can opine on moving forward.
Thank you, Secretary Moss. I know we have another comment in the audience. I will just say, you know, we have many entitlement programs represented on the council. The goal is to move folks to self-sufficiency, right? Like the goal is to move folks into permanent housing and to a place where they no longer need the support of the state. But until we can get there, you know, what can we do in the interim? And I think that's the purview of this council. So thank you, Secretary Moss, appreciate it. I thought it was Councilmember Lewis. Yes, we'll start with her first and then we'll move back over to you, Sandy.
Yeah, I'll be quick. I would be remiss if I didn't say something about the frontline workers. I just want to add a little bit more. I think, you know, a good number of the people that are serving folks in our field have been precariously housed or are currently precariously housed or were formerly homeless themselves. A good number of them are Black, Brown, and Indigenous. And I think that there's a couple of aspects for me as we talk about equity as it relates to access types of services, right? And exit outcomes, which is some like the three broadest categories as we think about the participants. I can't help but think about equity in terms of the workforce, given what I just described, the composition is. And so I think that I know that the state gives the money to the jurisdictions make decisions, but I think that we are in crisis, literally. A number of the employees that work for my organization, who I can't serve directly, are in crisis. And I'm hearing the same stories from across LA County and I'm sure other parts of the state. And so I think that if there's any conversation around ensuring that the workforce is supported, that's one thing. There's also a lot of peers, right? And there are some pain points to organizations who want to have like a corporate model. Like there's some adjustments that need to be made to make sure that we understand people are being triggered, we understand trauma, we understand bad day. Like, so I hope that we can have something in the plan that speaks to just improved support, guidance, whatever term you want to use, for the homeless and housing sector workforce. And income is the largest driver, but there's also some other supports that are needed as well. And it could be in the form of requirements in terms of local jurisdictions to make sure that their formularies for slot-based costs, whether it's bed nights for temporary housing or time-limited subsidies, rapid housing, whatever it is, are conducive to the local data that shows what the cost of living is, right? Like those are things that state departments can look at. And I know that may seem like overreach, right? But I think that there are some opportunities, but just something related to the homeless and housing workforce should certainly be an objective in the action plan.
Thank you, Councilmember Lewis. And not to be like a premature downer, I will say the goals that we'll review in the next few minutes do not have a goal that specifically reflects the need of the workforce. But having served in that workforce myself, and you know, certainly members on our LEAB who are in those positions currently, members of Cal ICH staff who have served in those capacities. Absolutely, these are drafts. So thank you for raising that very important recommendation. Sandy.
Thank you. So on that same note, now I can talk about workforce because that's actually what we do. So we have been privileged to be able to get funding for our prison to employment program for over a number of years. It is hugely successful in regard to anti-recidivism. One of the main aspects of it that is very important is the supportive services piece. So we know, and we have evaluators now that can actually share the data that shows that if people are coming out of, incarceration, if they get the supports they need, whether that's childcare, transportation, finding housing, all of that, the likelihood of them recidivating is so much lower. The problem is that that is not a dedicated funding stream, right? So I think when we're looking at the budget overall, when we're looking at moving forward with addressing homelessness, and especially for people who have been incarcerated, there needs to be dedicated funds for this population. We have another grant through the HIRE program, which is a dedicated funding stream, but it's going to go away at some point. It's kind of a new thing. And this was, I talked a little bit in the past about the hub and spoke model, where we're using like a larger organization to reach out to smaller organizations to be able to support people who have been incarcerated. But if we don't address the workforce issue, if we don't address getting good skills, getting supportive services, they're going to go back to homelessness, because the reality is like, so yeah, we can give you a place to live, but how do you pay for all of your expenses? So this piece is super important. And so what I would really, again, another challenge is to really look at where we're putting our money. And we put money into homeless services, but you just said, where's the workforce piece, right? And this is imperative to keeping people out of homelessness.
Thank you, Sandy, and thank you, Councilmember Lewis, much appreciated. I think we'll have some really robust conversations, a few agenda items down. So looking forward to, I don't know that I'll be the facilitator for your respective groups, but really looking forward to hearing the recommendations that you all put forward. We have maybe a few minutes if there's any other council member that would like to offer some thoughts. Anna?
Now we are? Yeah. Yeah, thank you so much. And Melanie, I really appreciate you bringing up the person-centered piece. I don't like being told what to do. Most people don't. And so really, how do we change the culture of our service delivery systems to really understand and be able to practice that person-centered piece? Mary, when you talked, I really made me think of housing first. Like, how do we actually implement a housing first model within California? And on that line, I think that, we have a very complicated system in California. We're big. There's many organizations. There's many people helping with housing. How do we bring together our housing developers, service providers, our public housing authorities, with the vouchers, our continuums of care, CalAIM providing housing services, and those supportive network service providers that are going to be there even after the person is transitioned out of Medi-Cal because they've gotten a job, right? To help with that prevention piece and help people maintain that. And then I think of Dr. Kuchel's study, where there's one affordable accessible housing unit per 30 people or something like that in California. So I think what I also heard is like, how do we get more housing? And that's available to individuals. And then lastly, when Audrey was talking, again, the eligibility piece, it is so siloed, and there's reasons for it. We know we have our different mandates, our funding sources from the federal government down to the state, but it doesn't make sense for people like the single male that you pointed out that needs the same thing to prevent homelessness as the individual with the family or the person with the disability. So, oftentimes our systems are set up based on these very siloed eligibility criteria that don't make sense for people. And I heard that from Audrey. So I just want to kind of point that out as well. Like anything we can do to look at the functional needs, if we're really trying to prevent homelessness and eliminate homelessness in California, it has to be based on that functional need of that person and where they're at, not what age or disability or how many kids.
Thank you, Anna. Very much appreciate that summary assessment. I will say, and this was put in the public chat that we have online, one of our lead members is in an encampment that's being swept currently by local law enforcement. And so a few of our staff are going to have to excuse themselves to support her through that. So she won't be able to continue to participate, but just wanted to highlight this is something that is in the public chat and that we will continue to support her through. So with that, I will turn it over to Cody to move us on to the next agenda item.
I'll be right back. All right, well, I just want to give a big thanks to the lead members who came today. Council members may not know this, but my team works really closely with the LEAB. Every month we go to them with a different question about our action plan, get their feedback, incorporate that into this work that we're doing. So they hear my voice probably more than they'd like, but just really appreciate all the time and preparation that you put into all of these meetings. I feel like, you know, the intention of that agenda item was really to set us, like to set our vision, right? To be really clear, like what is it that we are working towards? And we just really appreciate all of your all's thoughts about how we can be doing this work better. Because we're about to get into the nitty-gritty of the work. And I was actually talking to one of the council members before this meeting about the nitty-gritty work that we do every day. And sometimes you're like, it's easy to forget, right? Like what is the why here? And so we just wanted to start the meeting that way to make sure we are centered in that. So now I get the fun job of sharing some of the action plan details with you all. So we're going to go through, the way this is going to work is we're going to go through the vision for the plan, the guiding principles and commitments, and then the goals that we have set out. We heard loud and clear a few things at our March meeting. One, vision needs to be succinct. So hopefully we got that. And two, the goals, we want to have information about baseline data. Where are we starting from, right? We want the goals to be measurable. We want to have a little bit of understanding of like, where are we at now with these goals? So that's what we're going to present to you. We'll have a section, a time for council members to ask questions like, or give input about that information. And then we're going to have a separate time during this agenda item to break into smaller groups to discuss that a little bit more. So the questions, sort of like technical questions, will come first, but save sort of discussion items for the small groups. So without further ado, our vision, it is short. An equitable and just California in which homelessness is rare, brief, and never more than a one-time experience. So this is in your packets, no need to memorize it. I'm going to go through the different elements of the plan, but just look at that. If you have any feedback, we're interested in hearing it. We wanted it to be short, understandable, give us a framework for understanding, right? How do we do this work? And then, you know, below this vision will be sort of a how statement of here are some things that we think are necessary in order to achieve that vision, including our guiding principles and commitments. So the guiding principles and commitments include pursuing racial equity and justice, creating solutions for the full diversity of people experiencing homelessness. So we heard that from one of the lead members earlier. Seeking and valuing the expertise of people with lived experiences of homelessness, strengthening housing first approaches, balancing crisis response and permanent housing solutions, advancing trauma-informed care and person-centered services, aligning health, housing, and homelessness strategies, and increasing access to resources for California's tribal communities. So the reason this says guiding principles and commitments is that we think that by including these right in our action plan, we are saying that as members of the council, we are committing to the best extent possible, incorporating these principles into our work, right, when it comes to homelessness and housing. So think on those. If there are other things that you think would be important to include as guiding principles or commitments, we can talk those through. And then last, I'm going to go over the goals. So this is going to be a little bit longer because I wanted to provide some data before we talk about goals. I heard that was a request from one of our last meetings. So let me just start by saying we are moving towards using HDIS, our homeless data integration system, as much as possible. And we will still refer to the PIT count every once in a while, right, when it's appropriate. But our HDIS system is really where we're moving towards. And so I want to just say what's in HDIS, right? And HGIS collects information from local homeless management information systems, HMIS systems, across all 44 continuums of care, compiles it, deduplicates it, and so we have a picture of homelessness services that are happening across California, right? So it's not necessarily just like if one person uses multiple services, we would see their journey through the homelessness response system. So there's information about projects in a community serving people at risk of homelessness. There's data about the people accessing services, and then the projects that those people enroll in. So just a little bit of baseline data. I'm not going to go over all of these, but they're in your packet to reference. So based on HGIS, for the fiscal year 22-23, the number of people accessing services while experiencing homelessness in HGIS was around 350,000. So you'll notice that that differs from the PIT count, right, which is a one-night count of people experiencing homelessness. That was about 181,000 in the 2023 PIT count. So you'll see we're seeing people as they go through the system. Even if they just have one touch point, we are capturing that. The number of people experiencing homelessness for the first time was about 184,000. And the number of people exiting to permanent housing. This is going to be important for the goals, right? In the fiscal year 22-23, we had about 72,000 people experiencing homelessness that we could see exited to permanent housing. So when we talk about the work that the state is doing to prevent and end homelessness, like this is a crucial number to be looking at. So this is just, there's more data here. I'm not going to go through it in detail. But we can provide more information if you're interested from HGIS. One thing to say about this top line number, right? You'll see change from previous years up 17%. We're not going to get too deep into this, but again, this is service utilization data. So there is some world in which we as a state are saying, maybe we're not reaching every single person experiencing homelessness with services. So that number going up could be an expansion of our service system, right? We're seeing more people entering our system because we actually have more services for them. So it's very important that we're careful about how we interpret this data, right? Which is why we have our wonderful research team here. And I will not deign to answer too many in-depth questions about it, and we'll pass it to them if there are more. So let's get, oh, and a note about the data too. So we want to call out the racial and ethnic disparities in homelessness, right? As Secretary Moss said earlier, there are very clear and significant disparities in who experiences homelessness. So I just want to point out here, so this is for every 10,000 Californians accessing services in our system. It's hard for me to read that, but I'm going to strain my eyes. I believe it's 352 out of every 10,000 Californians accessing services while experiencing homelessness were Black, African American, or African. 187 were Native Hawaiian or Pacific Islander, and 178 were American Indian, Alaska Native, or Indigenous. And we also want to acknowledge that we know the data quality is challenging always, but especially in Indigenous communities, measuring homelessness among people, or measuring who is experiencing homelessness in Indigenous communities is a particularly challenging thing. We think this is an undercount, and we actually are working on that at Cal ICH to understand how to improve the data collection in those communities. So now to the goals. So it was a big run up, but wanted to make sure we had the information. This is hard to read on the screen, I can see now. So this is in your packets. I'll let folks flip to it as I will. But on page, I believe 19, so we have 6 draft goals, right? And within each goal, there's sort of a proposal or a set of ideas about addressing racial inequities within those goals, right? So we have the goals, and then we have the racial equities that we want to address within those goals. We have not finalized those specifically yet, but we have some listed here that I'll read out. So I'm just going to read through these goals, and then after this will be when we have, time for questions about the specific elements I just went over. So the first goal is create more housing, right? Plan for the creation of more than 2.5 million homes, with no less than 1 million of those meeting the needs of extremely acutely and low-income households by 2030. So if this language sounds familiar to you, it is because we copied it from HCD. So this aligns with the HCD statewide housing plan goal. Cal ICH leadership thought it was important that because HCD is on the council, right, that we are in line as a council with the goals that they have set and that we're supporting that work as much as possible. Specific inequities to be redressed might include racial discrimination and other forms of discrimination experienced by Native American and Black communities within housing markets, racial inequities and other disparities experienced by Native American and Black communities served by state-funded housing dollars or units, and inequitable geographic distribution of affordable housing options. So again, we're exploring how do we have really meaningful goals around addressing inequities within each of these. So these are some ideas. So goal number 2 is one that we're exploring. So we have that listed there, and it's about reducing the inflow into homelessness. So there's a crucial ratio that people often reference, which is the ratio of people entering homelessness as compared to those exiting homelessness every year. So we would want to reduce that ratio. Currently in our baseline data for fiscal year 22-23, the ratio is 1 to 3.7, right? So that means for every 10 people who exited homelessness in California in that year, 37 people either entered homelessness for the first time or returned to accessing homelessness services. So this is data that combines some prevention, right, information with permanent housing information. And then specific inequities to be addressed, right? Racial inequities experienced by Native American Black communities in continuous experiences of homelessness from year to year, risks of homelessness and access to prevention resources within those communities, disparities in housing referrals, and successful permanent housing placements within Native American and Black communities. So excuse me while I continue on talking, but I promise you'll have a chance to ask me questions soon. So goal number 3, help more people leave unsheltered homelessness, right? So we have create more housing, we have prevention goal with that ratio, and now we're looking at unsheltered homelessness. So we want to increase by X% the total number of people who leave unsheltered homelessness to either emergency shelter, interim housing, or permanent housing. In that same 22-23 fiscal year, the number was 92,000, almost 93,000 people who are experiencing unsheltered homelessness moved into a sheltered setting, right? So the intent here is to say, are people going from unsheltered homelessness into more sheltered environments? Are we moving people through the system appropriately? And we want to understand the overrepresentation of Native American and Black communities among those who are unsheltered, and then also the disparities in access to services and those housing options. So goal number 4 is help people move into permanent housing. Help more people move into housing. So increase by X% the total number of people who moved into permanent housing, right? So this is the permanent housing goal that we talked a little bit about earlier. 72,000 people exited homelessness and moved into permanent housing in fiscal year 22-23. And we want to again understand and address the racial inequities experienced by Native American and Black communities in length of time that they're remaining homeless, as well as housing referrals and successful permanent housing placements among Native American and Black communities. All right, on to the last 2 goals. And I haven't even, oh, thank you. My team is flipping the slides for me because I forgot. Thank you. So the last 2 goals, goal number 5, improve connections to health and social services. So we want to increase by X% the percent of people who are currently experiencing homelessness who are entered in and receiving Medi-Cal and CalWORKs. So this is really getting at the connection between health and housing, right? We are doing a lot of work on this council to ensure that we're talking across systems and that we wanted to have a goal that sort of reflects the successful work that we can be doing in order to increase the access to services and health services for people experiencing homelessness. And then disparities experienced by Native American and Black communities in access to healthcare and social services, care and services provided, and outcomes are part of the specific inequities to be redressed. And last but not least, goal number 6, ensure people do not become homeless again. So right where you can see we're moving through the continuum of care from prevention to housing to sort of prevention on the other end, so making sure people don't fall out of permanent housing. So this is ensuring that at least X% of the people who move into permanent housing do not become homeless again. And in fiscal year 22-23, the number that we have was 91% of people who exited homelessness and moved into permanent housing did not return to homelessness within 6 months. So there's a lot within that, right? We still want to understand disparities for Native American and Black communities within that, but important to keep track of how successful permanent housing is. All right, so we have the goals listed one more time, all on one slide in case we need them later. But just want to say, after all of that, what questions or input do you all have about the action plan, vision, guiding principles and commitments, any of the baseline data we presented, or the goals? So we have time now for sort of high level questions, right? We are, after this, about to get into smaller groups to discuss sort of like how your work relates to these goals, right? But for now, let's keep it to just sort of high level questions or input that you have about that. Yeah, Councilmember Damaris.
In looking at our vision, principles, and goals, I don't see the word prevention anywhere. And I think there's an expectation that that be included. That came up in our last meeting too.
Great. Yeah, I think that is a very good point. Thank you for pointing it out. I think we're trying to get at prevention with one of those goals, but I think being very explicit about that is important. So thank you for that comment. Yeah. Oh, yes, sorry, I should have pointed that out. So in our vision, we want to keep homelessness rare, brief, and a one-time experience, right? So rare meaning it doesn't happen ever if possible. Brief meaning when it does happen, it is as brief as possible, and one time meaning that if someone does become homeless and leaves that homelessness, it does not reoccur. So we sort of matched the goals to that framework, just as sort of a point of reference for how we were thinking of those and how they tie to our vision. Councilmember Lewis.
Thank you. I appreciate the connection to the rare, brief, and one time. Same comment, you know this already, that I think prevention, I want to echo that should appear, and hope that exploring next to number 2 goes away and it becomes a formal agenda and, or excuse me, a goal, and that the word prevention can be worked into that, because essentially I know that's what that's trying to address. For goal numbers 3 and 4, I think it would be helpful. So you have the ratio for number 2, but I think it would be helpful to understand out of the total number of folks that are in shelter for number 3, how many moved into permanent housing. So I think the percentages or ratios or whatever is appropriate would be helpful for both numbers 3 and 4, just for consistency. And I think just to frame it, and I see obviously there's some blanks to be filled in terms of what the actual increase percentage would be, but I think that would be helpful because these numbers alone mean something, but not, it would be more insightful, I'll say it that way, if you can put percentages or ratios for these as well.
Great, thank you. Yeah, Councilmember Sin.
I'd like to follow up a little bit on what Councilmember Lewis is saying, because I think she's getting to a great point, which is, what are we baselining this as? So if we are including ratios or percentages, and I agree with ratios, then we also need to have some sort of a baseline that we can set just to really understand what our progress would be over the next couple of years.
Yeah, thank you. Councilmember McGee.
Yeah, thank you for your work on this as a staff. I think the question I have for the council is, I'm struggling a little bit with the vision for an equitable and just California. I think that's throwing me off a little bit, just wondering what other people are either looking at with that. Just because if we're talking about an equitable and just California, we're talking about the entire state. And I know we were putting in there in which homelessness is rare and brief, but I guess the question I have is like, what does that mean for California? Maybe something a little bit more targeted. Then looking at the goals, I appreciate the goals. I believe that we need to incorporate a time-bound element for the goals. So I see we're saying the time frame is January 25 through December 27. But I believe that each of these goals should either be looked at the year mark. And Cody, I think I heard you say something about a 6-month figure. I don't know if it was the people returning to homelessness, but I would encourage us to, say, as an example, in number 2, where it says reduce the ratio of people entering homelessness as compared to those exiting each year to, 20% or whatnot. We need to have, a year on that, by, within 1 year, we're looking at it. So that's what I would encourage us to do, because the goals are specific, they're measurable. I guess we need to see if they're attainable, and then also looking at the time part of it.
Yeah, thank you. And I'll just add briefly, excuse me, I'm still getting over a cough. I'll just add briefly that the time is intended to be the time of the plan, so the dates that you outlined, except for that first goal, which aligns with HCD's timeline. I will say, I think message heard loud and clear, like, where should we be after 1 year, right? Where should we be after 2 years, after 3 years? The benefit of using, for a lot of these, is that it uses HGIS, so we can report out on the data pretty regularly, committing our research team to more work. But the idea is that, right, we can have sort of a more interactive set of data that we can have on our website that you can break down by demographic information or location, right, where we can really be understanding what progress we're seeing, and then doing a report, as we've done with the prior action plan, sort of every year, to say, here's where we're at with these goals, right? So that is part of the idea. And I think there's more work to be done in figuring out, right, these are goals, but then, like, what are you measuring within those goals exactly? And how do you understand the success is another set of conversations. And I see Dr. Huchel has her hand up. And so I think she might want to speak to that as well. So I'll call on you, Dr. Huchel.
I do. Can you hear me okay?
Yep.
Okay, wonderful. Thank you so much for allowing me. I'm so sorry I can't be there in person, just ran out of clinic. Thank you so much for all the work you put in. And overall, I'm really happy to support the plan. I have a couple of comments. One is I would love at a different time perhaps to dig in a little bit more about the numbers. I'm having trouble understanding the 1 to 3.27, because if we're that true, we would see an enormous increase in homelessness year over year. And we're not seeing a 3-fold increase or anything like that. So I think I just need a little more help understanding what that number represents. Second is, I think we could build on the tools section by developing specific statements on how we will achieve a goal. So for example, a goal may be to connect more people to healthcare. A tool to do that may be something like using strategic data with a focus on data sharing, and the how could be expanding our capacity to deploy integrated eligibility and enrollment portals to touch people experiencing homelessness. So I think what we want, let's say for a goal for people on leaving unsheltered homelessness, the how maybe to partner with providers to gain guidance on how to close encampments in a way that generates the highest number of secure shelter and housing. So I think that would be helpful. I think once we've suggested strategies, it'd be great to attach a section on measuring success. So if we're creating more temporary and permanent housing, how are we measuring the specific impact on people experiencing homelessness? Are we measuring the numbers of units and beds added to the system? Are the number of units targeted to ELI households? I think we want to think about how we want to measure these success measures. And then finally, just to sort of, I think, echo what some of the other members have been saying, to see more explicit racial justice language. I think it's great that we're naming inequity, but I think we have to use the data on disproportionality to be explicit about what we're trying to fix. It would be great to see an explicit call in the action plan to set clear targets for reductions in disproportionality. So thank you so much for letting me talk, even though I couldn't be there.
Yes, thank you for those comments. I will just summarize by saying we would be happy to work with you and your team on trying to move towards that vision, because I definitely agree that a lot of that and a lot of those elements and those details are really crucial. Any Yeah, Councilmember Johnson.
Thank you. Just, I heard in the presentation for the goals on number 1 that this was also consistent with HCD. I just feel like we have to say affordable. I know it's there, I know it's implied, but I feel like we have to say create more affordable housing and underscore that in that particular area. And then as we're thinking about the outcomes and the metrics and the baseline and the data, and I say this knowing that even at social services, there are going to be some limitations to our ability to do this, but I think it's important to push, is that we should also be looking at disaggregating, like you can use a percentage and show change over time, but who? And also be mindful in the way that we're looking at success of the individual, again, based on meeting where individuals are. It is sometimes someone has more complex needs than another person. And so it's, often referenced as the cherry picking phenomena. The person who might be getting eviction prevention relief may have been served, and so, but the person who might have additional needs. So I just want to make sure that as we're thinking about success and measuring it, that we're able to do some disaggregation of the data to say the who we were able to serve and make sure that our measurement of success addresses or considers the differences that individuals have in terms of needs and resources.
Yeah, thank you so much for that. And I will say, I'm just going to connect the dots a little bit. So there was a memo that our state funding and programs working group sent to you all that you approved on racial equity data collection that recommended exactly what you're saying, the disaggregation and with the identifying the who. So look, it's all coming together, y'all. But yeah, I definitely agree with that. And I just want to say to the success part, right? Something that one of our advisory committee members, Reba Stevens, always talks about is like, what does success look like? Like, how are we actually measuring the like nuanced definition of success, right? And so it's really important that we keep that in mind throughout all of this work. Yeah, Dr. Aragon.
So I do have a comment on number 1. So number 1 to me, I guess I think of a goal as a desired future state. And I see creating more housing as sort of an activity. And so and I'm thinking something that a desired future state where supply matches demand. So I reworded it, ensure supply of affordable housing matches demand. And that people sort of can understand that at any time. Is the supply of affordable housing matching the demand? And if it is, you've reached your goal.
Yeah, thank you for that. And I see Sandy had your hand up.
So I'm wondering if we could add workforce stuff into these goals. Like I see workforce falling under like health, and so number 5 and 6, right? So if we said improve connections to the workforce system, so that's not saying somebody has to get a job, but at least they've been connected. That is measurable by the workforce boards. That's something we could look at. And then ensuring that people do not become homeless again, part of that is having a stable income. So I'm wondering if that is something we could add.
Yeah, let's talk data, Sandy, you and me. No, but yeah, I definitely hear that would be important to be able to measure. Yeah, Anna.
So I appreciate and support the idea of making sure it says affordable housing, but I think it's affordable and accessible housing. And I mean accessible in 2 ways. One is that it's readily available to people to access, but also the physical universal design principles incorporated with 50% almost of the homeless population being people with disabilities, many with physical, but also with our aging population. So I just want to make that plug and totally support the workforce piece, ensuring that we have something about employment being part of our path out of homelessness.
Yes, definitely noted on the affordable and accessible. I think that we have that as a description in one of our tools, and it maybe was an oversight in here, but definitely thank you for the call out. I appreciate that. Yeah, Councilmember Lewis.
We can't talk about homelessness without talking about poverty. It's the most extreme manifestation of poverty. And then you overlay the equity piece and you overlay our inequities, lack of access to opportunities, et cetera. So I want to go a little bit further and given all of the departments and agencies representing here. I want to go a little bit further than just workforce development, because what we're talking about is economic mobility, economic stability, and then economic thriving, like pick a word, right? And so and we're talking about addressing poverty. So certainly a lot of the things that CDSS is responsible for in some part of anti-poverty programs, right? But given the economic landscape, even with the increases in payments for welfare to work and other things, it still is not even a fraction of what, or just a fraction of what rental costs are, right, with other things. And so I think that a goal related to poverty or economic mobility, stability, again, pick a word. Part of that is workforce development. Part of it is access to just resources and information and education. Part of it is education, right, itself, whether that's vocational or secondary, whatever it is. But I think that for me is broader, because poverty is at the center of a lot of this. Poverty, racism, inequities are at the center of this. So I would love a goal that broadens the topic, and then we get into the objectives relate to workforce development and specific interventions and activities.
Yeah, thank you for that. Oh, I see hands. Yeah. Collective, a joint hand.
Sandy and I are arm wrestling.
Great. Okay, perfect. I'll let you work it out.
So just a couple things of note. One, I really appreciate everything you guys have put together for the strategic plan. I see that you listened to our feedback from the last 2 meetings and really incorporated kind of what looks like a very more streamlined strategic plan, kind of in the traditional term of strategic planning. What I'm hearing around the room, though, from Dr. Aragon, for instance, is a little bit of, and from Dr. Kushel, is a little bit of this mix in terminology between how we get to goals, objectives, and metrics versus objectives and key results versus key performance indicators. There's so much terminology that we could be invoking here with strategic planning that, from where I sit, this council should make some decisions about how bold we want these goals to be and have the language reflective of that. So is create more housing the bold goal, or is that, do we need to improve that language and then actually add something underneath that that would be, to Dr. Kushel's point, the objectives, meaning here's how we're actually going to execute that. What I see here is a goal. These are very good goals with some explanation about what that looks like and a metric in there, but there is no strategy necessarily. So we might be jumping a little bit and kind of compressing a couple things into one statement, and you might not want to do that. Because as all of the state agencies and departments that are represented here in boards, it's really critical for us to understand where our piece of that is and how we are going to interject our collaboration and then setting policy within our own departments as we go ahead and execute some of these strategies. So there's a little bit of improvement on structure. As far as content goes, what I don't see, although I really love this piece about the tools and aligned equity frameworks, I think those are fabulous. There is not as much of an emphasis, kind of going back to the fact that some of us might want to be adding a few goals like workforce, like economic development. There's not as much emphasis on community. And when it comes down to it, it is not the state that is ending homelessness in a community. It is those communities. If you want to achieve net zero homelessness, you are doing that on the ground, working through vouchers, programs, services, connections. We are not doing that from where we sit. So if we don't start building some bridges to our direct communities and better understanding how they are dealing with this, I think our lived experience board is really critical to this piece. Our advisory board, some of our council members that do not represent just the state are critical, but there are not COCs here in this room. There are not housing authorities here in this room. And those are the folks that are going to be able to tell us, are we meeting the mark, and is this achievable, and what else do we need to do and set as the bigger goals, because they're living it every day. So there's a little bit more perhaps work to do there, and a goal that could add some of those pieces that really address the root causes of homelessness in our communities, which again, poverty, lack of workforce, all of those things that we have not gotten here yet. Okay.
Thank you. So in regard to poverty, and I am coming in a little bit late to this party here, but wondering like what discussions we've had around UBI. Because I know we're starting pilot projects out there, and you and I have had those conversations, Cody, but I wonder when we know it's just $600, right, that could change. So we funnel all this money into these programs, but we know it's pretty successful when we actually give the individuals the money. They're not spending it on crazy things, right? They're spending it on housing. Imagine that. And utilities and all of those things. So I wonder what conversation we could have around that at a higher level to make that available.
Right. So there is a lot here and I appreciate it. And my team is furiously taking notes. So I'm not going to respond to everything, but I think on that note, Sandy, with like the ideation, creating ideas, I'm going to move us to the next question because there's always more to discuss here. And we are happy to continue discussing in the future, and the clicker is not working. So someone will move it forward. But now we just want to give you all a chance to do like a little bit of reflection, really just thinking about, like with that vision, those guiding principles and commitments and the goals, right? Like what work is going on at your department or agency that connects directly to those goals, right? So we're already doing that in the big group a little bit, but just want to give folks a chance to talk it out with the folks around them. So let me tell you how this is going to work. So all of the council members in their packet or on their table next to their name tag have a single sheet of paper. Can someone hold it up if you have it? Perfect. Oh, amazing. So that is going to be very useful for the next agenda item. But we also included a place for you to take notes on that if you'd like, create ideas, etc. So you can just leave that there. What's going to happen is every table has been assigned a facilitator. Facilitators, can you raise your hands? I see Corinne, I see Dakshika, I see Courtney, I see Giselle, great. Megan was here, I'm one. So we're gonna sit at the tables. We're just gonna talk a little bit about these questions, take some notes. And the way this is gonna work is that members of the public who are joining in person can walk around, listen in. It's a time for council members to speak. And then within those small groups at the end, when we're wrapping up the small group discussion, there will be a chance for those in person to give public comment on what they heard in the small groups. Then we'll come out, facilitators will share quick summary of what we heard, and we'll have time for public comment from the large group online and in person. So this is where the logistics come in, y'all, but we're gonna do it. So if facilitators could move to their tables, council members don't have to move right now. That'll be later. We'll get you up and moving soon. But if facilitators can move to their tables, you can see the discussion questions here. So just a quick conversation, right? What work is going on at your department or agency that connects directly to one or more of the goals listed? And we have 10 minutes. Perfect. Yeah, thank you, Claire.
Cody, I wonder if I could.
Oh yeah, please. Go for it.
Just as folks are going into their breakout groups, I wonder if we might sort of add some context to this question based on what I just heard Secretary Sin talk about, which is, it's one thing to sort of connect to the goals and the work that your departments and agencies and organizations are doing. But I think it's another to think about, based on the conversations we've had so far in this meeting, how are we willing to push these goals further to really think about the impact that we are trying to have that doesn't currently exist? So I guess I would just, offer a friendly amendment to this question to say, how bold do we want to be? If what we've heard from our colleagues that we need to both strengthen and refine some of these goals, certainly based on data, but also based on some of the gaps in the system that we heard from the lead members that we know exist based on our years of experience doing this work. I just want to offer a little bit more flavor there and challenge us to, even if you're not doing some things now that connect to these goals, what should be done relative to the work of this council to really push this a bit further. So just wanted to add that as a reflection as we go deeper into the conversation.
Perfect. Thank you, Secretary Moss. I really appreciate that. So that's a great driving question for us. I know 10 minutes is not enough time to solve this, but it's just to get the brains working. So we'll call you back in a few minutes.
As well, and she's on the screen. Oops. Everybody can hear me now. Oh, can you?
I hate to do this. I know, but we'll take one more minute to wrap up your conversations. I'm so sorry. We will have more time to discuss. All right, y'all. I'm sorry. Make your final comment. Oh, I know. I want to make sure we get to. Okay, we'll give one more minute.
Well, retired and back as a retired and new attention at the moment.
All right. I'm sorry, but the next thing is our break. So I think people are going to be happy to get up and stretch a little bit. And there will be more time to have these small group discussions. Yeah. So I'm going to say, because table 1 has such a great conversation going, I'm going to call on table 1 to be the first to share. So can the facilitator please share a quick summary of what they discussed?
Over there.
Thank you so much. I'm not Megan, but I helped the table get through our discussion. Really exciting thing. So Undersecretary Falls from CDCR talked about the success of the existing pre-release activities related to robust behavioral health services, other supports 1 to 2 years prior to release, but the need to expand that will help address and equip folks that are returning back to the communities. Also talked about the number of folks that are aging, that are exiting. Some, as I said, who didn't even know they were going to exit, so they may not have family connections, but they have a lot of physical and possibly other disabilities. And so CDCR is looking at the possibility of creating some community-based and custody programs to really provide more appropriate supports and connect them to some of the other community supports. And then we talked about part of the gap is the robust nature of a lot of the behavioral health services inside the state prisons, but then, having to start over again in the community. So I'm looking directly at you. I'm glad you're looking right at me. So we talked about potentially with all of the community resources coming, I said this, she didn't say that, all the community resources coming through Prop 1 and other things, potentially creating some type of project where there's actual transition from the behavioral health services in prison to community-based and an actual care coordination team to really make sure that there is not an interruption of care. So, and also potentially doing that with Calais. And then Dr. Aragon talked about, we got rushed a little bit, but because of him hearing about some of the challenges with documentation and people not being eligible, not being able to be supported because of documentation, we had a little bit of a brief discussion about birth certificates, et cetera. And since vital records come under them, he's gonna do some digging to see if there's some supports that his department can provide to reduce the barriers of accessing vital records and some other things related to vital records. And then we talked to Councilmember Johnson Hall, who of the finance agency, and really exciting potential opportunities. And so in terms of the trying to address some of the inequities and disparities, they've discovered that they may have an opportunity through the national mortgage settlement and some resources that have not yet been used from that to fund counseling agencies and other agencies doing important work to educate and provide supports to people in high need areas. And they're working with HCD to try to identify where those high need areas are. Can I say the dollar amount? May I say it? Possibly $50 million. Possibly $50 million to invest in providing supports to underserved people and communities. And then also looking at Section 8.11 and possibly using the opportunity to apply for some funds to access project-based vouchers and be able to provide supports to the non-urban hubs across the state and possibly, you know, access recapture vouchers from states that are not using their dollars.
Well, wonderful. Thank you. And thank you for volunteering to pinch facilitate at the last minute, Councilmember Lewis. Dr. Aragon, I apologize for rushing you. But there will be more time to discuss after the break, I promise. So I'm going to move to table 2's facilitator to quickly summarize what you all discussed.
Quickly, okay. So we started our conversation really just talking about coordination and really how to make things seamless for folks. And so I know there's a lot of interest in the next segment of this activity as well. We started with Anna just kind of sharing that multiple goals that are identified here, DOR really covers and provides supports and services in those areas, including helping people find housing, coordinating available services, maintaining housing, and then of course, creating more accessible housing for folks, and talked a lot about really the importance of having a goal that's focusing on workforce and employment, and the importance of including that in that goal 6 as well to support housing stability. There was a lot of conversation at the table around data and data sharing and how that's really going to be important in making decisions. And then moving over to Councilmember Bass, there was conversation about goal 5 being a key area of the work of DHCS, talk about street medicine and all of the work that's happening with CalAIM and really trying to reach folks that haven't received services before. And then talking about a future initiative, which is adding supportive employment. Actually, they're working on a waiver with the federal government right now to look at expanding services in that area. It's a long time down the road, but something that is in the works and looking at including as well. And again, just more emphasis around data sharing to coordinate across systems.
Great, thank you. I'll do our table 3. We talked about some of the available credits that TCAC has available. We were making connections between housing credits and disasters and talking about the disaster credits that are available. We were talking about, I think we really focused on the question of how do you acknowledge the majority or the large plurality of people experiencing homelessness may fall into one demographic category while also doing the person-centered, population-specific services that we're being called to do, and how do we measure sort of both of those things? I feel like that's something we talked a lot about at this table. Also looking at goals related to mental health, right? And trying to understand, are we addressing the mental health needs of people experiencing homelessness? So I'll pass it to table 4.
Oh, thanks, Mayor Rowan. All right, so there were a couple of important, I think, common themes across our group. Oopsies. And one of them was that although not every council member department in ICH is giving out, direct homelessness funding, we all have a role to play and have an impact that we can make. And there were some common themes that came up in terms of trying to address turf wars and barriers that might happen at the local level, and how we can support better coordination. We talked about how we have a role oftentimes even just to be as influencers in those relationships at the local level, and being thoughtful about how we're measuring what we want to see in our work at the state level. So on the Calvet side, thinking had a conversation about how we might be able to look at the ways in which vets are being served in behavioral health plans or workforce plans at the local level, especially those vets experiencing homelessness. How can we actually push to see more out of those kinds of local plans, and then build those connections to create collaboration, including doing things like working more directly with county boards of supervisors. On the Caltrans side, how, again, we might not have services, but we have a really important role in our encampment coordinators across the state, and how the encampment resolution funds were a really great example of how, when we collaborate, we can work together with communities to build more connections and trust, and then ultimately more resources for the people who may be residing in state right-of-ways. And then really exciting out of our last meeting, how there was a lot of inspiration around the tribal coordination we can also do in this space, and how the shelter lease program at Caltrans has also been another opportunity where locals can create some creative new opportunities to build housing options in their communities. And then on the workforce side, how much of the federal mandates and targets come from the feds, but we at the state level could also do more to ask our locals to be, what are they doing in terms of outreach? It's not just who knocks on your door when you come to receive workforce services at the American Job Centers, but how can we seek to ask our locals to do more to do that proactive outreach and engagement, and then think more creatively about how we're measuring success. So thanks, team.
Table 5.
All right. We were also in the midst of a discussion, but here's some highlights. CDE is connected to goals 3, 4, and 5 for creating opportunities for professional development and connection to career education. School districts have liaisons that connect families to resources and connect families and children to social services, such as connecting them to the community, those with resources for housing and healthcare. The Department of State Hospitals is focusing on prevention for those with severe mental illness and those incompetent to stand trial, helping individuals be connected to health and social services, those who are not already receiving those services. Individuals in, also assisting individuals in diversion programs and preventing them from becoming homeless again, and helping individuals connect to permanent supportive housing after those programs. And housing community development is focused on goal number 1, also specifically setting a firm metric for housing, and how much we are closing the shortage of housing. Also, it is important to identify the inequities. All these goals mention the disparities. So there is a great disparity for housing by race and ethnicity. So we should be more explicit on how communities are not having those discriminatory practices. All right.
Thank you. I moved, sorry. And now table 6, last but not least.
Well, we had the 2 co-chairs and Director Morris. So it was a very big picture conversation, I'll say. But here are the few themes which I think are important as we think about, and I think some of what the co-chairs were doing was thinking about the vision of the goals and the plan. So one of the points of conversation is around how broad do we want to go? And some of that conversation, and we're going broad, was do we really want to think about connecting poverty-related goals? So I think the bottom line after a lot of discussion between the council members was, while it's important to really think about poverty-related goals, it's also extremely important to be laser focused on the immediate crisis. And there was worry that there might be some scope creep because, as Susan mentioned, it's the Interagency Council on Homelessness, it's not the Interagency Council on Poverty. So given that, I think the co-chairs and Director DeMorris want to really think about how we connect the dots between the goals that are being laid out now, the 6 of them, but also potentially think around the continuum as people are experiencing homelessness on the street, as they're moving into interim housing, as they're being permanently housed, and on the prevention side, as well as the housing retention side, Secretary Galley said maybe we need to think about, for example, when you think about prevention, think about it in public health terms where you have primary, secondary, tertiary prevention, and think about how you connect those dots with our council member departments and agencies in that way, where we do have, for example, prevention-related goals right now. We have goals around making sure people do not become homeless. When you look at that inflow, outflow, the goal number 2, prevention is built in there. And then you have prevention when you have the goal around making sure people don't return to homelessness. So that is potentially a way, as you think about the continuum of people and how they're experiencing homelessness or how they're trying to remain housed or how they're trying to thrive, how the different departments and agencies can connect to each of the goals, and thinking about prevention in kind of a tiered manner. The other thing that was brought up is how the LEAB kind of experiences that were shared, especially the LEAB member who was a former foster kid, and how those kinds of situations really strike really to the heart of what we're trying to do here, where we have folks who are in institutional settings that are government institutions, and how do we really prevent those folks from continuing down a track that leads to unsheltered homelessness. So hopefully those kinds of settings can also be part of these goals as we think about drilling deeper. But is there anything I missed?
You did it.
Okay.
Well, thank you all for the robust discussion. I'm just going to say, if you liked that, you're going to love what we have after the break. So that was sort of a miniature version of what we have planned for the sort of second half of the meeting. Before we go into break, after this share out, we want to offer a chance for public comment. So if any members of the public in person have filled out, Karen, has anyone filled out something? Okay, none in here. If there are any members of the public online who would like to make a public comment, please raise your hand. Seeing none, we will move almost to the break. I'm going to pass it to Megan first.
Apologies, folks. Hate to keep you from a break, but just want to offer an update for a LEAB member who's actively experiencing this, who was being displaced, unfortunately. Sort of had to excuse myself, but some of the silos that I think that exist in the state certainly exist at the local level, where you have a county who is unaware of the actions of a city, vice versa. There's no service coordination, there's no information sharing. And so unfortunately, where this LEAB member exists, it's currently 105 degrees outside. You saw sort of the canopy that she was under as she was offering her personal testimony. So we are working with the city administrator's office from the city that she exists in, and from the county office, to ensure that persons in that encampment are offered services, whatever services they may be eligible for. So just to highlight, I think this is an area that Cal ICH, through our division of local initiatives, certainly can stand to step in, where we have persons who exist in the state, throughout the state, who are unaware of how to connect with their systems of care. And that's certainly something that the state has a responsibility to step into. So with that, I'll leave you with, it looks like it's 2:10. So we'll say that we'll come back at 2:20. Thank you all.
And I would be scolded if I didn't say council members shall not discuss council business during the break. And if so, you must say it in front of the whole group after the break. Thank you. Okay, I'm trying to be generous in life now. So we are gonna come back together. Oh, yeah, no, that was a little generous. All right, so if people could take their seats. I know it's hard to come back from break, but I appreciate it. Thank you all for coming back together. Let's see if this clicker works now. Yes, amazing. So we are going to continue the conversation. By talking about the actual activities that we want to include in the plan. So you can see the structure of the meeting was, helping us vision with the LEAB, talking about the elements of our plan, making sure that they are moving us in the right direction. And now we're talking about like, what are the actual activities, projects, what is the work we want to put on paper in order to achieve these lofty goals? So we are going to have brainstorming groups. We'll do a similar thing where we're in groups. I will explain the logistics in a second. Then we're gonna discuss what are the areas of overlap between our departments that you're sitting with, either overlapping activities or work that you can collaborate on, right, that complement each other. And then we will share out, and that will be the next hour-ish. So as I said, the goals are really to like share the activities that you all are thinking about including in the new plan, identify areas of overlapping and complementary work, and then on your worksheets, you will see there's space for at least 3 new activities for coordination or collaboration with some of the people that you're talking to. So feel free to use those as a guide. Don't be limited to only 3. But we ask that if you fill out those pieces of paper, you give them to us. We will send them back to you. We will scan them, but we just want to make sure we capture what folks are talking about. So here's how it's going to work. Y'all are in your tables. These are not your first tables you're going to be in. On your single page sheets that you have, it says agenda item 5, I believe, and it says session 1, session 2, session 3, and it tells you which table you're going to be at. So can I get a volunteer to tell me what table they're supposed to be at for session 1? Any council member can read it out. All right, I see table 5 from Councilmember Clendenin. Great, so that's clear. So in a second, you're gonna get up and you're gonna move to your session 1 tables. We're gonna talk for 20 minutes, so you have longer than you did before. Then Claire is gonna call us and she's gonna say, move to your session 2 tables. You're gonna get up, you're gonna move, it's gonna be a different group of people, and you'll have the same discussion with different folks. So the questions stay the same, but the people change. We are gonna skip session 3, I'm sorry, because we are running behind on time and we wanna make sure folks get out of here on time. But if there is someone you see on that list that you're like, man, I really wish that I could have talked to them, feel free. That's the goal of this meeting. So we're here to build collaboration, to build communication. Once the breakout groups are done, we'll do the public comment in the small groups, then we'll come back, we'll share out, and we'll do public comment in the larger group. And that will be the end of that agenda item. So what are the discussion questions? So what we really want to focus on, right, are really like, what are the activities that your department and agency can include in the new plan that sort of move us toward those goals that we were just talking about. So you all started talking about that in your last discussion, so it's not going to be too different. But then really focusing on like, what areas of overlap do you have with other council members? What work could be complementary that you're working on, right? We've heard some cross-pollination in the share out from the last groups. And then what could you do to coordinate your work or create new activities to meet our goals and guiding principles, right? So this is really saying, okay, we want these lofty goals, we want this lofty vision, right? What are we each doing to move us toward those goals and that vision? So pretty simple. I think those are all the logistics, but I'm gonna look at Claire, okay. And we're gonna leave these questions up on the screen. Your facilitators will have them. to prompt if needed, but based on the last one we did, I don't think we're going to need the prompting. So everyone can get up and move if they are not sitting at the table that it assigned them for session 1. You will end up back at your original table, so if you want to leave things, you can. Yeah, thank you.
5 more minutes in this group. All right, everyone, I hate to stop these great conversations, but we need to wind up. And no one's listening. What? All right, everyone. We need to rotate now to session 2. All right, everyone, please start wrapping up in the next few minutes. All right, everyone, if we could head back to our original tables that you were sitting at, please, and then we can move on to public comment and the next agenda item. Thank you. All right, folks, we're going to get started with report outs from the tables. Looking at you under Secretary of Homelessness, Dakshika Bakarema, to get us started deep in conversation. Thank you guys for the robust discussions, very much appreciated. Seeing continuation of robust discussions, I will move us over here to, you made eye contact, which is unfortunate. So we will, folks, if you, folks, it's even worse. Okay, there we go. We're gonna go ahead and get started, folks. Cody made unfortunate eye contact, which means we're gonna start with table 3. Dakshika Bakarema, our lovely Deputy Secretary of Homelessness, was gonna be the first. Yes, you were, ma'am, but you were deep in discussion. If you're ready to go, though, would love to hear from you. Thank you.
Thank you very much. The first session we had HCD, TCAC, CalHFA, and they're actually doing some very interesting joint activities already, including one is that there is an MOU that was created between HCD, CalHFA, TCAC, and DDS to submit an application to the federal government for what is called Section 811 vouchers. These are rental assistance vouchers that can be used for people with disabilities. So they're still waiting to hear back, but that was a very promising activity that they wanted to kind of highlight around how the various council members are working together. The second thing they want to explore, and this was Director Vasquez who brought this up, I don't know if he's still here, where HCD, CalHFA, TCAC, the folks at the table, want to really explore this idea when any housing proposal comes to each of their departments and they are going to target people exiting homelessness, They want to explore ways to move those projects to the front of the line and make sure they can expedite financing from those three departments. And so that's what they would like to explore, to really move up the housing construction and financing timeline. So that was the first group. The second group, we had Councilmember McGee, and he was mentioning how, oh, I should mention the first group was really focused on goal 1, as is evident from what I said. Councilmember McGee was very interested in goal 5, improve connections to health and social services, and highlighted a new program that they have called Community Schools. This is where various schools get funding where they can bring dental and medical to the schools and really wrap around services to the students. So he was thinking that might be an opportunity to really connect people to more services connected to goal 5. And then the last thing he mentioned was they have these homeless education technical assistance centers. I hope I got that correct. And there are 3 to 5 across the state. And it's really a way to find out how you can replicate promising programs. Like, for example, in the city of San Francisco, they have used the school as a shelter for families with children who don't have places to live, where after school, they remain at the school and they receive temporary shelter at the school. And then that's like respite for those families. So those were the things that Councilmember McGee highlighted, and end of report.
Thank you, Deputy Secretary Wickrama. Always appreciate hearing from you. With that, we'll move to table 3 with Cody Ziegler and folks.
Great, thanks. So our first conversation was with Councilmember Lewis and Dr. Galley, and I think we had like a large existential conversation sort of about the nature of goals in general. But I think the main thing to highlight here was I think there was general agreement that like whatever we're doing needs to be as clear, like crystal clear, right? We all need to know exactly what we're trying to achieve. Because I think, as Councilmember Lewis said, ambiguity is the death of progress, which I wrote down. And identifying ways sort of like during the COVID pandemic, right? We all put down what we were doing, came together, had a very clear focus and goal, had an all of government response, like identified red tape that we could get around that, you know, we could put off for later in order to achieve great things. And I think that was sort of the sentiment of like, and I think Councilmember Lewis, you said this, like coming, like we need to come back to the table with everything that we can do to hit our goals, right? Like that should be what we're trying to do here. So that was sort of a main focus of that conversation. I don't know if either of you want to speak to just focus is the word. Yeah. And commitment. And sort of an acknowledgement that like actually achieving the goals would be one of the boldest things that we could do. So that was our first conversation. And then Councilmember Lewis was stuck with me, and we had a conversation with Elisa and Ricky, really talking about the work of Caltrans as a connector, right? And thinking about their work in some ways as like state prevention work, right? We know where these folks are. We have a touch point with people living on state right of way. How can we, you know, if Caltrans isn't the one that can go out and offer services, how can we partner with COCs, with local governments, with other state departments to say, come along with us. We know where these people are. We know that they need X, Y, and Z services. And really a lot of the work that's been done to sort of change the culture around like, how do we work with folks that are staying on the state right of way? And then also talking about the tax credit allocation committee and all of the tax credits and bonds, and how the prioritization and the scoring system can really determine what the state or what developers prioritize and who to house. So really focus on that goal number 1, right? Like, are we housing, who are we choosing to house? Who are we choosing to prioritize? All those decisions are made in the tax credit process or in the development process. and trying to understand, like, are there equity considerations there? Like, how can we utilize that process to make sure that we are moving towards our goals? Did I miss anything? Did I just want to add?
Yeah.
Please.
Oh, this just came up in another table conversation with HCD and CalHFA, and just aligning the financing, because right now developers have to go from one to another to get funding potentially. And so there is a work group in progress to create a plan on how we can coordinating financing. So it's just more of a one-time thing than having to wait for the next funding source to come in.
End of report.
I like the very official sign off. It's a good segue for me to remind folks that I don't think need reminding, but for many of us in the room, we were either leading local efforts or state efforts during the time of a global pandemic. And it truly was an all government approach. It truly was expected that each of us be here and avail ourselves, not just in terms of a thought partner, but our resources as a collective. To achieve a common goal, right? And I think we've heard very clearly from the governor, we've certainly heard very clearly from our co-chairs, while we've not declared a state of emergency, this is that. So this is a time for all of us to come together and to respond and be thought partners with one another. So I appreciate the reference from table 3. Thank you. With that, I'll move over to table 2 with Courtney and team.
All right, thank you. So our first session included CDCR, Caltrans, and DOR. And we had Elisa here was again sharing that, they really don't offer services directly, but they can partner with anyone and really have the ability to communicate with people and try to leverage what they do have to work with others. So really emphasis on connecting to other services and supports. And then we also talked a little bit about data and real-time information that they can offer. Again, we're identifying where individuals may be that could benefit from services and how to then connect with those populations with other services and entities that would benefit. There was also discussion around overlapping populations between DOR and CDCR, particularly with individuals with disabilities, the aging population, and that's a growing connection that they're really interested in building on further. And we talked a lot about the importance of providing specifically employment services prior to release and really making sure that there's a focus on in-reach services, and that carried over actually into the second session as well. And then we did go into discussion around actually moving into disasters and that California faces those on a regular basis, and that there's really an opportunity to get folks connected to services at that time, and the importance of really bringing all of these systems together when people are in crisis, and moving out of that process to be able to connect to long-term services and supports. And then moving into the second session, it included CalVet, Department of State Hospitals, and DOR again. And we talked a lot about overlapping populations, and again, a lot of focus again on employment and really kind of, helping ensure longevity of stability and the importance of assisting with those employment outcomes. There was also conversation around benefits counseling and the value and importance of providing that information and education, specifically examples of individuals who were concerned about looking into employment, that may make them ineligible for housing benefits, and the ability that someone like DOR might have to offer those benefits counseling supports to help, and again, ensuring that people are able to achieve viable employment to help in sustaining that housing. And we talked a lot too about the emphasis of the importance of supporting things at the local level. Really, that's where everything's happening, and how can we help in developing that coordination and connection within those systems. I think that's an overview. Is there anything else from this group that you wanted to add? All right, that is it for us.
Thank you, Courtney and team. I will say, yeah, the emphasis on local support. As we heard earlier this afternoon, we had a member of our Lived Experience Advisory Board who is being actively swept from her encampment. I had to excuse myself for a period of time. We continue to work with our local partners at the county level, the city level, where she currently exists, and of course with the COC. So having those relationships and supporting those local partners is paramount to our collective success. With that, we'll kind of segue over to table one. And Lisa, if you can lead us through a summary of your tabletop discussions on my behalf, which by the way, thank you, appreciate you.
Now it's on. Yeah, absolutely. Thank you, everyone. Our first session was a small group with Department of Education, OES, and Hannah representing CDSS. Gina first discussed the programs currently in place in OES to serve those who are displaced or made unhoused by disasters and violent crime, and distinguished those programs in those two categories. So they also have currently homelessness youth exploitation and homelessness youth emergency services hotline. I believe that those are, Gina made note that those two are distinguished by the categories of either being displaced by disaster or by violent crime. She also noted that they are not a direct service provider, but a fiduciary agency, institute. And what we discussed was how while there aren't direct services and they aren't currently housing folks who are experiencing homelessness generally, that it seems like a major preventative measure to focus programs on housing those who could be displaced permanently by disasters or violent crime. So for me, the prevention flag was waving in my mind when we had this discussion. We also discussed how difficult it is to measure the effects of prevention. It's like, how do you measure the effects of a good thing sometimes, and how effective it might be to figure out a way to measure prevention and the success of prevention, and how the ramifications of it, how it ripples out. Then William shared as was shared by our first table 6, the Department of Education's new community schools program that they're working with community and other agencies to support children who are currently experiencing unstable housing or have mental health needs. That while they do not move people directly into housing, they do have a liaison with the school districts that are supporting vulnerable families. Hannah then asked a question about transportation, like who's responsible for transporting students who are in the margins or experiencing vulnerability, that they're currently in the process of clarifying those roles and responsibilities. So really a free form conversation. Hannah at CDSS then mentioned how basically all of the programs within HHD, the Housing and Homelessness Division, touch on the goals of the action plan. And I thought that was really powerful. For our session 2, Tammy Foss of CDCR shared that a lot of the CDCR, a lot of the folks are aging out or experiencing a crisis of that they're experiencing crisis of folks aging out or exiting into parole and exiting into precarity, essentially, like not being released into situations where they know they're going to be released unhoused. And there was a lot of conversation between DOA, Susan at the Department of Aging, and CDCR about the crossover between their needs. Susan shared a great statistic that all categories of populations decreased in poverty. I'm not sure if this was last year, the year before, except for older adults. So that older adults remained in poverty in the same static way. So that while there are programs that target the aging population, there's still more to be done. Gustavo asked a important question about about HSPA, the federal program that offers technical assistance to Braid, Medi-Cal, and other kinds of funding, and then asked, are the outcomes of that work being called out in the action plan explicitly because the work is so parallel? Now, I don't really understand the question, I'm not gonna lie, but everyone was nodding their heads. It seemed very important. So I just wanted to say that. Yeah, thank you so much.
Way to go, Director Velasquez. Appreciate that mind-boggling question for Cal ICH staff, and I agree, very important. But thank you, Lisa, for giving such a comprehensive overview in my stead. Now I'll turn it over to our council's other lovely Deputy Secretary, Corinne Buchanan.
Awesome, thanks. All right, so our first conversation was with CalVet, DSS, and CDA. Thanks, y'all, for the conversation, which was really, I would say, primarily focused on access and coordination, focused on prevention, and then lastly on what I would call more creative and innovative solutions to meet the needs of people with the most complex care needs. So in terms of access and coordination, we talked a lot about some models that are actually working well at the local level to do this kind of work, including the 211 work in San Diego as a model for how we might be able to actually have a unified sort of one-stop shop to connect people to where they need to be, and how we might be able to explore supporting models like this in other parts of the state. And as we were talking about the kinds of resources and sort of the navigation resources and the no wrong door approaches, we actually, when we were talking, learned about programs that some of us didn't know about. And so it was a kind of a good reminder that even in our roles, we don't know about all of these various resources, and just, I think, helps make the point that there is a need for both increasing education about these resources and also better coordination and navigation to simplify in many ways how we're trying to do this work. We talked a lot about the importance of prevention, and also talked a little bit about like how important it is that we're really collecting and analyzing the outcomes that we're experiencing in the prevention efforts that we do have. And there are a number of prevention efforts happening across the state, both so that we can understand what does and doesn't work, but also so that we can tell the story, because being able to effectively tell the story helps us build the kind of support we're going to need to be able to scale these models and really make a difference. And then we talked about some cool innovative approaches. We talked about, especially as I mentioned, to serve the needs of people, either seniors or people with disabilities, including home share programs that are popping up in different parts of the state. We talked about models, permanent supportive housing models where residents can age in place. There's some awesome work happening at CalVet that we're going to be able to understand the results of pretty soon, that we again can help us make the case for why we need these models, and some work happening with some of the waiver programs at Department of Healthcare Services to do this work. So thank you to that fun group. And then in our second conversation, we had CalHHS, CDPH, and Hannah from DSS. And I would say we talked a bit about the different kinds of spheres of influence that we have in trying to accomplish these goals. We again talked a bit about prevention, and then we did what I would call, had a conversation around going big on what matters most, and what I would refer to as like keeping our eye on the prize in this space. So in terms of spheres of influence, Tomas talked a lot about like how in the CDPH world, we think about the things where we have control because we might be running the programs ourselves. We talked about places where we have influence, like how can we embed a focus on homelessness in all of our equity plans or in other places where we're doing our day-to-day work. And then where can we share our expertise, an example being in the CDPH realm around harm reduction approaches. We talked about prevention in our group and the importance of targeting our prevention resources, thinking a lot about how when we think about prevention work, it is the place where the interaction between poverty and homelessness is a little harder to untangle because they are so connected, and how important it is to embed prevention work into our some of our existing safety net programs, because those are the places where we're most likely to reach people who have some of the greatest needs. And then we again got into this idea of what I called keeping our eye on the prize, but how do we make sure that we have a simple and understandable goal so that we can stay focused on that goal. Thinking about how sort of a corollary in our state is that we are in a place now, thankfully, due to a lot of the work of people in this room, where your income level and whether you're in poverty or not doesn't impact whether or not you have access to health care because of our expansion work of the Medicaid program, California, et cetera. We have we still have some ways to go, but we're reaching near universal access to health care. And I think posing the question on what it could look like if we could say something similar on the housing side. And again, last thing I'll say, Megan mentioned it, but a focus on thinking and reflecting on our experience during COVID and how when we have sort of an unwavering focus on a goal, how much we can accomplish collectively. Thanks group.
Thank you, Deputy Secretary. Wonderful readout. We will now go to our final table, table 5. Giselle, if you can help us understand what was discussed between the two sessions.
All right, in our first session, we had the Department of Public Health, the California Workforce Development Board, and the Department of State Hospitals. Our strongest connection here was between the Workforce Development Board and the Department of State Hospitals, specifically getting people who exit state hospitals into employment services and utilizing things that worked in the past, such as remote work, working well for those involved with DOR. DPH also has a small amount of funding to also work on prevention. We also discussed the need for outreach or connection at the local levels, finding opportunities within existing funding and resources to make those connections, such as having liaisons be involved in local situations, having COCs create task forces to help triage those tools and resources, having individuals out living in the community who are partnered with mental and behavioral health. We don't know to what extent, so making those more clear. And then also breaking down the silos that are at the local level. We also talked about creating or coordinating the work. So continuing these conversations, connecting with the local level, so local development board officers, and having that greater outreach, and then also having more accountability. Is there anything else I missed? And in our second session, we had, again, the department, the Workforce Development Board and Cal HFA. We had some introductions here, so people who did not know each other. So getting to know what each of these departments do. Cal HFA is working on distributing the national mortgage settlement dollars and would like to expand into more legal homelessness prevention. So those who have been wrongfully evicted for discrimination, and the need to utilize networks for identifying housing coordinators who do homelessness prevention. Also, the need to connect at the local level, similar to how CWDB works with the Chancellor's Office. We could do something similar with learning labs for those local communities. Also, the need to revamp tribal policies and the methods for getting money out, and proactively reaching out and involving those at the local level before things become an issue. We also talked about thinking how we as a state could create a process with access to funds for communities who have struggled to access. So current methods are not working, so we need to reimagine that bar. How do we work with specific communities and projects, and how do we meet people's needs where they are? Did I miss anything? All right, thank you.
Great. All right, and I'm now Megan. So I just want to say, like, from what I heard, the conversations in the small groups were extremely robust. So I just want to thank all of you for the time. I know it is a long time to be talking and to be getting up and moving and sitting with new people and making those connections, but I think it's so important. And I just want to play a little bit of I'm looking at you, Will, as I'm putting a teacher hat on. Could you, if you heard something today that was new or something that you learned that's relevant to your work from another department or agency, would you raise your hand? All right, I see a fair number of hands up. So this is, the idea here is like, we're going into this, all these meetings, you're probably meeting with us all the time, being like, we're talking about the action plan again. Like, this is the energy we're trying to bring into that work, right? Is to say like, what can we do? What can we be inspired to do based on these goals, based on this vision, based on what we heard from our lead, right? In order to make this a reality. So thank you all for participating in that. Before we move to our next agenda item, I want to pass it to Claire to facilitate any public comment that might exist online or in the room. So Claire, go ahead.
Great, thank you. So this will be your time for public comment on this agenda item. There will be general public comment at the end of this meeting. Everybody who would like to speak on this agenda item will get 2 minutes. Karen, were there any in person? Great. And then anybody online, please raise your hand or press *9 if you are on a phone. Okay, great. Oh, we do have one person. So Josh, could you please pull up a 2-minute timer and pull down the slides? Okay. All right, the phone number ending in 3713, please go ahead and speak. You have 2 minutes.
Hi, this is Ruthless. I've been calling and emailing these meetings since like October. Last summer, my area in Los Angeles was targeted by an ERF. And what I was calling this meeting for was because I know they oversee that. I was hoping the people that got into the hotel, I was not one of them. I was hoping that they wouldn't just be kicked out in a few weeks or months, like what ended up happening to them. They were kicked out and then they came back to where I live outside. So since that, I've been trying to advocate for them. Before they got kicked out, I was trying to get them into the Inside Safe program, either by relocating to a hotel that's in Inside Safe or having their motel become Inside Safe. Their motel did become Inside Safe, but the city never didn't carry anyone over, basically. And they didn't even do the Inside Safe operation locally. So it's basically a vacant motel. And now some of us scrape up $110 every once in a while combined so that we can stay there and charge our phone or take a shower. That means that when the program ended, our rent went up more than 4 million% annually because it's the same people that got kicked out of the program paying to have a shower there every once in a while. Why okay, if you all are trying to end homelessness, you need to be able to do it for one person, right? And there's no accountability or follow through. We've studied these programs like Roomkey, and we know that it takes more than 6 months to get someone into housing. So to have these ERF programs that have 6 months maximum, it's pointless. We know that we can't connect people to housing that fast, and everyone just gets kicked back out to the streets and goes back to their encampment. If you want to email me, my email is ruthlessruth@gmail.com. That's ROOFLESSRUTH. Thank you.
Thank you, Ruth. Okay, and I've been told we have a public comment in person. All right. And would you mind just introducing yourself quickly in your 2 minutes? All right, go ahead.
Hi, my name is Ariane Dalade. I'm with Leah San Diego. I have a question on policies and regulations or red tape. How are you guys going to counter that? Thank you.
Thank you very much. Okay, I will pass it back to Cody to facilitate the next agenda item.
All right, thank you. So we can pull up the slides again and we'll go to our last agenda item here. So We'll wait till the slides are back up. So we talked a little bit about, our vision for the work, why we're here. We talked about our goals. We talked about what we are going to do individually in order to achieve those goals. We sort of wanted to spend the last little bit of time focused on, what is Cal ICH's, statutory mandate and what the action plan achieves and what it does not do, right? Like, as we said before, a plan can only get you so far. There may be other pieces of work we need to support us to achieve our goals in this work. So we're going to go through that really briefly. It seems like we may be having some technical difficulties with the PowerPoint, which we will figure out. But if you look in your meeting packets on slide 34, it talks a little bit about what our plan does. And I can, oh, perfect, we're getting it up. And I can just briefly go over that, right? So you heard this, like our plan communicates our state's vision for preventing and ending homelessness, right? It creates and monitors goals to achieve over the course of the plan's timeline. It aligns all of our work towards a common set of tools, and it identifies and sets priority activities for council departments and agencies to work on in service of our goals, right? So that's sort of the main function of the plan as it exists right now. Super interested if folks have other thoughts as to what our plan achieves in here. But then there's also a question of what the plan doesn't currently do, right? It, by sort of definition, does not explicitly set funding priorities. It doesn't provide policy recommendations, right, specific to the legislature or to the governor's office. It doesn't hold specific programs accountable to performance metrics necessarily. It doesn't assess overall collaboration with across council members, and it's not used as a tool to provide sort of training and guidance on relevant topics. So I think what we just wanted to do was seed a few of these comments as a way of asking the question, right, what else is needed in this work? Because we know, as I said, the plan will not solve the problem. So are there other pieces in addition to this plan that can either support our work of the plan or that need to happen sort of in conjunction or at the same time as our work that's going on in the plan? So that is slightly a vague question, but let me find our discussion question. So I think we should go to slide 37 now. And acknowledging that we don't have infinite time here, I'm just going to move us straight to discussion for you all because it seems like we like the discussion piece. And in the slides, there was an example. You can go all the way to 37, please. Thank you. So the question really is like, what other groups, strategies, policy decisions, right, are needed in order to best support our implementation of the action plan to achieve the collective goals and sort of meet the vision of our lived experience advisory board members that they laid out. This is the time to be as creative as you'd like, right? Say whatever you think would be helpful in this work alongside of our plan. So I'll give folks a chance to think about it. Anna, I see your hand.
Okay, so I know this has been said a couple times today, but all the magic happens at the local level for the people. And so where are our local partners and how are we engaging with them directly? And then there's also partners that the state doesn't have any kind of real interaction with, like they're funded through HUD, right? Our voucher programs, our public housing authorities. How are we bringing this all together to make the difference for people that need this support?
Yeah, and I think that's a really fair question. I think one thing that I want to ask too is, right, like not only how are we including, because we can have sort of feedback sessions with local partners on the plan, et cetera, but how are we working with them to ensure that this plan is useful for them, right? And actually, like you're saying, like help support them in the work that they're already doing. Yeah. Yeah, and I think Councilmember Johnson Hall had a comment. Is that right? Or I saw a motion, a vague motion.
I will just, I want to support my fellow council member here. I've always wondered why the PHAs are not represented here. They have a touch point that I don't think any of us have. And they are so critical to this work. They have access to the vouchers. They have access to the organizations that monitor those vouchers and also the support services that are critical to these populations. We need them in this conversation. And so I just wanted to say that I hear you loud and clear, and it is something that I'm unsettled with.
No, sorry. No. I appreciate it. I see Councilmember Lewis has a hand.
Yeah, I mean, I think a lot of these, I mean, we've answered these questions, I think, throughout the sessions, but I'm gonna say something because I'm not afraid to say it. As we talked about seeing mountains move during COVID in an unprecedented way, not all, but in part, some of those mountains were able to be moved because it was a state of emergency. And so part of what would be really helpful to do some of the things that we're talking about is a state of emergency related to homelessness in the state of California.
Yes, Sandy.
I did have a question about that. Why can we do that? Can we say this is a state of emergency? And if we did that, what kind of funding then, what kind of support would we get at a higher level?
So really good question. So just to declare a state of emergency in and of itself is not sufficient, right? It has to come with resources, capacity, et cetera. I will say there are communities across the state of California, too many that I can name off the top of my head, but I will, looking at Councilmember Lewis, the county and the city of Los Angeles has declared a local emergency. There are many more examples in Northern California who have done a local declaration. This is not something that we have had capacity or resources to develop further across the state as an entity independent from local emergencies, but are in support of the local jurisdictions who have declared disasters. Yeah.
I was just going to add one thing, and that is it may not come with specific funding or the needed funding, but it does reduce some of the barriers that we face. And so maybe we look at it in that realm of if there's a way that we can have some sort of state of emergency, because it does remove a lot of the barriers that we are experiencing now.
Yeah. Thank you, Elisa. All right. I just want to take us back a few slides. And again, my apologies. I'm still working to support the lead member, working with the local city jurisdiction, their local law enforcement, their local emergency services. Shout out to Gina there in the corner from State OES who got me the contact information. Although I will say, and this is not something that's news to the company in this room, it's ridiculous that it takes 2 hours to find somebody at the local level to connect with, to ask a very simple question. So I know locals, having been a local myself, I know locals will say the same of the state. So just want to highlight for all of us to be very mindful of, again, who it is that we serve, the services that we're intended to provide, and to avail ourselves to those appropriate persons. So thank you, Gina. Thank you, OUS. Very much appreciate it. All right, I'm gonna take us back a few slides though, and thank you, Cody, for walking us through. I do want to highlight, because this action plan, as I've said in a number of council meetings, this action plan will be very different than action plans of years past, right? I'm looking at the council now. There are very many of you who've been on this council since its origination in 2016. This action plan is intended to be very, very different. And some of those differences are actually founded in some of our fundamentals, our 19 founding statutory obligations. A few that I want to highlight here, is certainly more conversations to come, but let me just, yeah, so number 5, for example, so 19, not going over all of them now since we have 10 minutes and I absolutely will leave time for public comment. But number 5, for example, so one of Cal ACH's founding statutory obligations is to coordinate existing funding and applications for competitive funding across state departments. You all are very much aware, in our last council meeting I highlighted, we had an audit, Cal ACH had an audit. The auditor found that Cal ACH could not say whether or not we had done these things, and so had recommended that Cal ACH incorporate our 19 statutory obligations into our statewide action plan, which is something that Cal ACH agreed to. And so this is something that will be new for the action plan, but there will be an incorporation of the 19 statutory obligations, as well as a measurement of our success in meeting each one of these obligations. But there are just a few I want to highlight. 5 is one, and then I'll move to 6, to make policy and procedural recommendations to the legislatures and other government entities. Cal ACH has never stood in the position of making policy recommendations to the legislature or to other government entities. That will be a drastic change, I will say, that we have support of from our, the governor's office, as well as our co-chairs. This is something that will be very different for the action plan in the next fiscal year. Number 7, to identify and seek funding opportunities for state entities that have programs to end homelessness. Cal ACH has never proactively sought funding outside of what exists from the state. That will also change. Thank you, Councilmember Hall, I appreciate you. And last but certainly not least, number 19, to collect, compile, and make available to the public financial data provided to the council from all state-funded homelessness programs. This is a drastic change, which means that we will be working with each one of your departments who have programs that were identified in AB 977 to collect that financial data, to incorporate it into a dashboard, and to make it publicly available. But what I can say is that at its core, Cal ACH is here to serve the state of California, its council member departments, its state agencies, and certainly its legislative appointees. We'll do all of this in partnership with each one of you, and hope that you all do that with us in the next few months to come. So with that, gosh, am I on time? I might be on time. That's fantastic. I didn't think I was going to be on time. But with that, I'll turn it over to Claire, who will open it up for public comment. But thank you all for bearing with us today.
All right, so now we will open it up for general public comment. Now I will open it first. Are there any public comments in the room? Okay, great. So I will move to online public comments. I see Ruth, you have your hand. So I'm going to unmute, and we've got the timer up. All right, Ruth, go ahead.
Thank you. Hi. Yeah, so I heard someone mention, I don't know if it was Claire or who, I'm on the phone, so I can't see everyone. I think AB 977 HMIS data quality or something was mentioned. I'm an unhoused person, right? Like I live outside, I've got an HMIS file, and I'm just baffled that I can't like log onto HMIS.com or something and look at it. I have to do the only way I found to find it, like to view it, is Freedom of Information Act request. And it's just ridiculous to me that there's all these this energy on like collecting this data and we can't even view our own data. Like, I know that there's hundreds of agencies that can view it, but like us, like the people that it's about, the subject of the data, and we are supposed to be the owners of the data since it's our own data, we can't view it. Like, and so I would like to see a focus on, if we're going to be surveilled this heavily, like having a way to see who our caseworker is, because a lot of people don't know, and see if we're waiting on a voucher, or if we were assigned a voucher and not told that we were, or if we were given a housing match or any of that stuff. I know I was able to view HMIS records using that workaround with the Freedom of Information Act from this group of people that were served by the ERF grant targeting the LA River, and all the people that were kicked out of the motel that now pay like whatever they can to access it sometimes, just like they did before the program. They all have these, like, one person had an 11-page case file of notes about how they don't want to be in the hotel. But like, you can't say that about someone who's literally trying to pay money to be in it and has receipts. Okay, so yeah, I also wanted to express concern and support for the person on the lived experience board who's getting swept. Please realize that that is something that we deal with every single day. Okay, I've had my phone taken, my generator. I mean, it's ridiculous. Please, like, learn from this experience and support this person. Thank you.
Thank you, Ruth. All right, are there any other people online who would like to speak? Okay, no other hands. I will hand it back over to Cody to close us out.
Great. So just once again, want to thank all of you for your time today. I know it is an extra special meeting today in that it is both extra and was hopefully special. But I do want to take the urgency that we've heard from, multiple members of our LEAB and folks in public comment about this work. Like, I think we all feel the urgency of this work and hopefully have ways to move forward towards our goals and the vision that we're hoping to see after today. So thank you again to council members for your insights and comments. You can see we're trying to move this action plan forward in a meaningful way, and your contributions are crucial to that. Thanks also to anyone who joined and listened in as members of the public. We know that you are, deeply important to this work, and just appreciate all of your feedback and your participation. And I believe that is it. So with that, the meeting is adjourned at 4 o'clock. So look at that. Yeah, thanks again, everyone, and hope to see, join us at our next council meeting on September 5th, and get a popsicle on your way out.
Oh.